Hello, ladies and gentlemen. Welcome to the 13th annual Prostate Cancer Awareness Event. Normally, we have this event at the State House. Unfortunately, last couple of years, we need to have this event virtually. Welcome everyone who attended this event before, and welcome to everyone for whom this event is the first time they are attending. You might have noticed that I'm wearing today yellow and blue colors. It is not an accident. I am from Western Ukraine. My husband is from Kiev. And I would like to ask everyone for a moment of silence to acknowledge people who are currently losing their lives, becoming refugees, country whose cities are bombed out of existence. I apologize. And warriors of Ukraine, brave and proud warriors who are standing between dangerous authoritarian regime and the civilized Western world. Moment of silence, please. Mm-hmm. Never before, looking at what's happening right now in Ukraine, having been a refugee from Ukraine in 1979, from the same kind of regime that currently is present in Russia. Never before was I so present to the privilege of having had an opportunity to come to this country and having had the kind of opportunities this country has to offer refugees like me, past refugees like me. It is a great pleasure for me to introduce Cheryl Bartlett, who is currently CEO of Greater New Bedford Community Health Center, a former commissioner of the Department of Public Health in Massachusetts. Cheryl has been a co-MC of this event for many more years than I can remember, probably for at least a decade. Cheryl, please.
Good morning, Faye. And Faye, thank you for giving us that opportunity to have a moment of silence. This has been a very hard thing to watch, and I've thought of you so many times during this, and so glad you're safe in here in our country with us. So I pray for everybody there and the world at large. So today we're here to talk about prostate cancer, and as Faye has said, I have been coming to this event since the first one. I think I missed maybe the second one, so I've been to 12 out of 13. And since meeting Faye, as many of you know, she is a really dynamic and passionate medical leader in the efforts in public health. And she led the charge for breast cancer and women getting screened and having mammograms and being able to have early detection, treatment, and better outcomes. And she now is a passionate leader for men. And I love how she's coined the Manogram, and that we're trying to get the same sorts of technology and diagnosis early for men so that they have the same kinds of outcome that women have enjoyed for a very long time. And we're very fortunate to be in the state of Massachusetts, where our legislative leaders recognize the importance of the work of AdMeTech and Dr. Stern, and have provided funding so that we can really continue to promote prostate cancer awareness. And also a governor who continues to recognize this day every year as Prostate Cancer Awareness Day and the important public health priority that it is. So I'm delighted to be with you all today. I thank all the legislators for taking their time to be with us yet again and continue our fight And look forward to maybe next year seeing you all in person, but nice to at least see you on the screen. Faye, thank you for your faith in me and keeping me involved in this important work.
Thank you so much, Cheryl. Our first speaker today is Garth Greiman, Secretary and Treasurer, Massachusetts Prostate Cancer Coalition, and member of the Prostate Cancer Action Council. Garth, please.
My name is Garth Greiman, and I'm an officer of the Massachusetts Prostate Cancer Coalition. We have been longtime partners with AdMeTech and Dr. Faye Stern in organizing the annual Prostate Cancer Awareness Day, known as PCAD, event at the State House. It is always an exciting day, especially because it showcases the strong support that all of us in the prostate cancer fighting community receive from the state of Massachusetts. So once again, thank you to Governor Baker and to all state officials for your work helping us fight this disease. Ordinarily, PCAD takes place on the grand staircase at the Massachusetts State House. It is an awesome setting, filled with history as well as the normal continuous stream of daily legislative activity. We are always gratified when our elected legislators who, like us, want to eradicate prostate cancer, take time from their busy schedules to come to our podium in the main hall and express their support for our cause. Since prostate cancer impacts many men and their loved ones, the personal stories they tell from their own families and many constituents bear witness to this ongoing fight and are the best evidence of the work that all of us have yet to complete. MPCC has a slogan, Conquer and Cure, which speaks to our ambition to end this disease. As you all know, even though COVID is currently in decline, PCAD once again can't be celebrated on the grand staircase and must be held on Zoom. We continue to miss the people-to-people connections made possible by this event, as well as the sense of authority and commitment as conveyed by the State House setting. However, the silver lining of Zoom is that all of us can accurately hear our various speakers without being distracted by the constant background buzz of legislative activity. This way, we can be sure that all of you in our audience can hear about the deep resources that are available to help prostate cancer victims and their families. Our organization, MPCC, is delighted to be part of this team, and we look forward to helping anyone impacted by prostate cancer to have the best possible outcome during their treatment and recovery. I'm now going to share my screen with the home landing page of our organization's website. The site's address is www.masspcc.org. We have worked hard to make our website a deep source of information, which is being constantly updated for everyone in the prostate cancer community to find resources, make connections, and seek support for themselves and their loved ones. Who is MPCC? Our mission is to educate, connect, and support men at risk, newly diagnosed individuals, survivors, and their families. We also work to make it easy for anyone impacted by prostate cancer to be able to find organizations and professionals in Massachusetts who are dedicated to help men fight this disease. You will hear much today about the facts regarding prostate cancer. After skin cancer, it is the most commonly diagnosed type of cancer for American men, impacting 1 in 8 across all ethnic groups. Sadly, it disproportionately impacts men of color, which is why reaching this community is an important goal for MPCC. Other things to note about us are that we were organized more than 20 years ago as a not-for-profit organization. We board members are all volunteers, and importantly, most of us are long-term survivors of this disease, and that we currently have over 2,000 members. We have doctors on our board, as well as a distinguished medical advisory committee that keeps us well briefed on all developments in the fight against prostate cancer. This committee helps us organize our annual symposium as well as other online education events. Every dollar we raise supports the cost of these educational forums, makes it possible to provide free access to any interested parties. Now I'm going to use the home landing page of our website to walk you through everything that we are doing. The green block leads you to the registration page for our annual symposium, which this year will be held on May 20th. Traditionally, this meeting has been in person, but to keep our members safe, the last 2 years we have been virtual, and we will be virtual again in 2022. Our annual symposium is our signature event and is designed to provide accurate and up-to-date information on prostate cancer, diagnosis, treatment, and related research. This year, we are expecting more than 350 attendees who will hear educational sessions led by leading physicians, researchers, and healthcare providers. The virtual format offers us and our attendees significant flexibility since our audience can choose where to focus their time. The agenda is still being finalized, and we urge all of you to register as soon as possible so you can electronically receive the full program details when they are available. There's no charge for signing up, so you really have no excuse not to join us. The purple listen icon will lead you to various links that enable you to access the digital media that we regularly produce. As we grow more experience with this technology, we hope to keep expanding the information that is available. Please scroll through the list of rich subjects and then return on a regular schedule to see what new material has been posted. I'd like to especially call out our podcasts, which have become a very good way to share information. Interestingly, we have a growing list of worldwide listeners, even from as far away as Australia, which proves the value of this information and how easy it is to make it available through digital connections. To repeat, please regularly stay in touch with our listen page to see what new subjects have been posted. Next is our orange subscribe icon, where we invite you to give us your contact information so we can include you whenever we post new information. We are always learning about research, educational opportunities, communication forums, and other resources that we really want to share with you. Reaching you through our website is incredibly productive for us, and it should be easy for each of you to pick and choose how you want to engage with MPCC. And if you ultimately value this relationship, we ask you to consider becoming a member of MPCC and making a tax-deductible contribution at any level that's comfortable for you to help support the continuation of our activities. Lastly, behind the blue icon, you will see our curated list of the many support groups around the state who are very pleased to help anyone impacted by prostate cancer and all the related issues. I want to especially note that we have a number of spouses of prostate cancer patients who are very active in our network, including leadership roles in support groups. Please reach out and make these connections if you need help or just someone to talk to. In closing, we at MPCC believe no one should be alone when they are fighting this disease. We have many friendly people who want to help you. If you are diagnosed or living with prostate cancer, you should be very hopeful regarding your long-term quality of life. On a personal note, treating prostate cancer has come a long way since I was diagnosed in 2003, and I like to say that I'm living evidence of a good medical outcome. Now, in 2022, you have many new and better options to consider for treatment. So reach out and ask for help as you consider your choices. I know the PCAD program needs to keep moving along, so I want to thank you for your time and attention today. We at MPCC are very glad to be part of the prostate cancer fighting community and want to do whatever we can to help all patients successfully address their disease. Thank you again, Dr. Stern, for inviting us to participate in this event.
Mass Prostate Cancer Coalition is a great partner to AdMeTech and to prostate cancer awareness, and appreciate the work that they continue to do for us. And I'd also like to acknowledge with us this morning is Representative Jerry Cassidy, one of the co-hosts of our prostate cancer awareness event, and has been a strong supporter of the work of AdMeTech and prostate cancer awareness. Thank you, Representative, for being with us this morning. And I don't see yet Senator William Brownsberger, Senate President Pro Tem, who is also a co-host, and I think is the reason that I got involved with AdMeTech when I was the Commissioner of Health. He called me in to say the Department of Public Health should get involved in this important work, and that's how I met Dr. Stern. So thank you both for your leadership. Very critical to have you. I now get the pleasure to introduce a video with Lovo Collego, who is the founder of the Community Health Awareness Network and member of the Prostate Cancer Action Council, and a very key partner to AdMeTech Foundation out in Worcester County. They've been one of the leaders in the state to really address particularly the impact on men of color. As you've heard this morning, 1 in 8 men have prostate cancer, and we know that men of color are 2 times more likely to die from prostate cancer than white men. So very important work happening out in Worcester County. So thank you for your video.
Hello, my name is Lovo D. Collego, and I am the founder and CEO of Community Health Awareness Network. Today, I am grateful and appreciative and really want to say thank you to Dr. Stern and the entire AdMeTech family for such a great opportunity and their support to the immigrant community in Worcester and also to CHEN, which is the organization that AdMeTech is partnering with in Worcester. Before I go into speaking about our relationship or partnership with AdMeTech, I just wanted to share a little bit of information about Community Health Awareness Network, why we exist in Worcester, who we are, and the things that we do in Worcester. So CHEN was established after seeing or recognizing the healthcare needs and the challenges that members of the immigrant community were facing after graduating from nursing school and after working into multiple medical settings. So CHEN was established in 2018 and we're here today. But who we are. So CHEN is a nonprofit 501c3 healthcare organization in the state of Massachusetts. We are dedicated to improving the health and healthcare access for low-income African immigrants in the greater Worcester area. And our mission basically is to empower and strengthen immigrant communities through health awareness, outreach, and access to quality, competent, comprehensive, and culturally sensitive care. Our vision basically is to see and empower African immigrant community, individuals who are knowledgeable on prevalent health and or disease condition and are able to make informed decisions concerning their health and health care. What we do, basically our work relies on 4 pillars. We educate in the community. We train individuals through CPR, helping individuals learn about basic CPR skills where they can recognize or be able to help when someone is in a situation where they have to jump in and administer CPR. We also advocate for members of the community, and we are big on being a community resource. That said, we help individuals find resources within the community, and organizations such as AdMeTech has been of great help or benefit to members of the community because they are providing resources that usually would not just come across. And with our time working with them, individuals in the community, I've had people call me and say, oh, thank you very much because your event you had, I've learned a lot about prostate cancer. Now when I go to my doctor's office, I know the question to ask as it relates to men's health. And these are things that we want to see. This is the impact that we're looking for in the community. One of our major goals is to promote annual primary care visit. And that's there. We know primary care visit can be any time within the course of the year. But primary care visit, we know and understand that most of the screenings are done, especially within ages. So for a man who is having prostate issue, when he goes for his annual visit, he gets all his PSA done, he gets all the screening done. But nevertheless, in between when he's having issues, he can be able to still call his primary care. And with that, while we're promoting primary care visit, we're also trying to reduce the frequent emergency room visit. We know and understand our members of the immigrant community living in Worcester. In fact, Worcester is a very diverse city, which I love. And the immigrant community here, we understand that a lot of time, most of the men don't go to the hospital until something is emergent or until they need an emergency care. So they just frequently fly to the emergency room. But in order to reduce that or to help reduce that, we are in the community working with AdMeTech and teaching people about prostate cancer, especially our men, our uncles, our brothers. So when they get to their primary care visit or annual visit, they can be able to ask the appropriate question and know some of the tests that are being done. And moreover, it is expected when the doctor approaches them with this information, they already have idea as to what it is, and they are being able to place value on it and make decisions that is based on not just statistics, but literature, based on the fact, based on research, because they've gotten to understand it, not information they got from Facebook and other social media, but they're able to make informed decision at that time when they're having conversation with their primary care provider. And also, once there is understanding, there is value, we believe that there will be an increased trust in the healthcare system, which is something that is lacking because of so many reasons. Coming from Africa, there's a culture barrier. There is the language barrier. There is lack of access to care. So there is so many things that hinders why people get care or don't get care. So we are trying to reinforce that within the community. So our education is not just only a disease condition, but also helping people to find information that is valuable to them. And our activities is basically health workshops. We do health fairs. With our connection with AdMeTech, we've been able to establish our barbershop project, which basically on a given Saturday, we go into the barbershop knowing that men usually gather in the barbershop and we just distribute information on prostate cancer, have a one-on-one conversation if possible. We also do health outreach, and in the time of this pandemic, we've been working with the city of Worcester. We've been working on the Get Vaccinated Worcester project, where we're encouraging people to get the COVID vaccine. And we also volunteer our time with the city at the sites where they are giving vaccination. And most importantly, we do pop-up clinics, and we usually go to churches and be able to work with the church members to give the vaccine, working with the city and the church. So our partnership with AdMeTech started in 2019 after Dr. Sokolov, who actually was the first person to ever speak to any of our prostate cancer event. After he spoke at the event, he connected Chen to AdMeTech. He reached out to Dr. Stern, who reached out to me, and since then we've been in partnership within the community here. Chen is now a member of the Prostate Cancer Action Council, and together within the time we've been partnering, COVID aside, we've had 5 major prostate cancer events within the Worcester African immigrant community. And like I said prior, that the barbershop project was developed through that through our relationship with AdMeTech. And also one of our major events where we had Senator Moore, we also had Representative LaBeouf on, was our May prostate cancer and COVID-19 pandemic Zoom event, which I think was great. The outcome was great. And since working with AdMeTech, we've had a lot of information given out to individuals. We've reached out to over 500 or more individuals and members, not just from Worcester, but people from around the world, basically, because we put our event either on Zoom and sometimes on Facebook, and people are able to access it either before, during the event, or after. And I think the relationship has been great. I just owe a big thank you to Dr. Stern and her entire team, the entire AdMeTech family, for such a great effort, because it is helpful to us. Our fathers, our brothers, our uncles, they're all able to benefit from such an effort. And we just want to say a big thank you to AdMeTech. So how do you reach us? Anyone who's out there wanting to collaborate with us, wanting to just partner with us in the community, doing some outreach, you can find us, or we can be reached. Our address is 46 Honeysuckle Road, Worcester, Massachusetts, 01607. And also our website, you can find us on chenglobal.org, and you can email us at info@chenglobal.org. We want to say again, thank you. Thank you to AdMeTech. Thank you to Dr. Stern. Thank you so much for everything.
Thank you so much, Lova, and in particular, my gratitude for your outstanding work in Worcester area, Worcester and surrounding areas. And we hope to continue this partnership for a long time to come. It is a great pleasure for me to introduce a few messages from our sponsors, Philips Royal, a global company, two global companies, and Sanofi.
Sanofi will work tirelessly with integrity and passion while partnering across the industry, because fighting cancer demands teamwork.
What will the future of MR look like? Meet Jamie. With his family history of prostate cancer and a higher than normal PSA blood test result, his urologist has requested a prostate MR scan to better determine the next step. Before Jamie's arrival for the MR exam, the scheduling automatically adapts to reduce the waiting time needed for Jamie. In the smart changing room, a virtual nurse makes sure Jamie is fully prepared. Before Jamie enters the MR room, the technologist already has a preview on the relevant health information and knows where Jamie is in his care pathway. The technologist then gently greets and engages with Jamie so he knows what to expect. After Jamie lies down, the system increases Jamie's comfort with a personally selected ambient theme that helps him to relax and stay still. Meanwhile, the system informs Jamie visually on time per scan and gives breathing instructions, so he is reassured with what's coming next. For the technologist, the system provides visual guidance on where to optimally place the coil and automatically suggests smart protocols based on Jamie's health condition. Throughout this process, the technologist can confidently focus on engaging with Jamie to address any questions, as Jamie's physiological measurements and exam setup are well taken care of by the integrated smart solution. A central remote expert and AI algorithm will help to ensure fast scanning while delivering consistent and high-quality imaging. And concurrently, this integrated AI-powered engine is processing the newly acquired data, extracting the initial findings, and making live adaptations to the scanning. Jamie's case is then referred to an international network of specialized experts for the best possible diagnosis. After this fast, fully automated and personalized MR exam, Jamie's report and case files are now represented in his own digital twin. And this living and collaborative document is being utilized by all stakeholders involved, facilitating integrated precision diagnosis. Thankfully, after the multidisciplinary team reviewed Jamie's recent tests and imaging results, it concluded that although Jamie has a higher than normal PSA value and a family history of prostate cancer, his PI-RAD level indicates it's unlikely for clinically significant cancer to be present. The integrated solution approach provides more confident diagnosis, clear care pathways, and predictable outcomes, not only to the clinicians involved, but also to the patients. It means Jamie can easily track progress at home and feel more in control of his journey.
Officially kick off our 13th annual Prostate Cancer Awareness Day. I see both our hosts have joined us, Senator Brownsberger, Senate President Pro Tem. Thank you for joining us this morning and for your unwavering support for prostate cancer awareness and the work of AdMeTech. And again, Representative Cassidy here with us this morning. And I did see Representative Williams with us, who will be speaking just a little bit later. I'd be remiss not to acknowledge the dedication and commitment, the inspiring and relentless leadership of Dr. Faye Stern and her work at AdMeTech. She tirelessly fundraises for the resources so that we can educate providers so that they can give the best care possible, that we can educate men and their partners so that they can get the best care possible. We know today, I've been a nurse for many decades now, and today prostate cancer outcomes are so much better than they used to be because we can diagnose better men that have low-grade cancers and men that have really aggressive cancers and need different treatment. Instead of treating them all the same, that gives them much better outcomes. So the work we do here today continues to have a domino effect across the Commonwealth and across the country, and that we can help the men in our lives improve their care. And so I am honored to continue to be an MC here, my 10th year, as Dr. Stern acknowledged. And I thank all the participants. I see we're up to over 33 participants this morning. And so without further ado, I would like to introduce Senate President Spilka. And I think that she has a video presentation for us this morning. Again, thank you all for being with us.
Good morning. I'm Massachusetts Senate President Karen Spilka. I'd like to thank Dr. Stern, President and CEO of the AdMeTech Foundation, for inviting me to speak today. Dr. Stern's pioneering work at AdMeTech helps develop critical tools for prostate cancer, including early detection, which is so critical to improving health outcomes for men with prostate cancer. Unfortunately, in recent years, death rates for prostate cancer have increased, with more than 34,000 men dying in 2022 alone. Far too many men and their families bear the burden of pain and hardship this disease can bring. This disease also lays bare the ethnic and racial disparities in our healthcare system, as the rate of prostate cancer is much higher among Black and Latino men. But Massachusetts has a history of leading the way when it comes to innovations in healthcare and medical technology, and a commitment to addressing historical racial inequities. Far from merely improving outcomes for men with prostate cancer, I am hopeful that with the talent our state is assembling, we can create a cancer-free future. During Prostate Cancer Day, we remember the men who have lost their lives to this disease. As Senate President, I pledge to continue to support men who are battling prostate cancer, to help deliver the care and treatment they need, and to defeat this devastating disease, and to make sure that Massachusetts remains committed to ensuring that people have every opportunity to live long and healthy lives. Until that cancer-free future is in our grasp, I encourage all men to talk to their healthcare providers about prostate cancer. And I encourage all of us to continue the fight for cancer awareness. Thank you very much for all that you do to ensure a healthy future for the men of Massachusetts. Be well and take good care.
Thank you to Senate President. I would like to acknowledge several remarkable individuals who joined us by Facebook and by other means. Among them, Senator Mike Rush, our champion. He will speak in a few minutes. Representative Galvin, Representative Vargas, Senator Lovely, Representative Cabral, also Representative Kip Dix, who is also a prostate cancer survivor. Thank you for being here, and thank you for your support. Once again, it is my pleasure to introduce Speaker of the House, Massachusetts Speaker of the House, Ronald Mariano.
Hi, everyone. This is Speaker Ron Mariano. I want to thank Dr. Stern and the entire team at AdMeTech for putting this event together for the 13th Annual Prostate Cancer Awareness Day. I am honored to address you all for the second time as the speaker. Since I took the gavel, so much of the work that we have done in the House has been about recognizing the disproportionate impact that the pandemic has had on our society and building back stronger than ever. Due to the many underlying racial inequities that exist throughout our society, we have worked hard to ensure that our recovery efforts are carried out fairly. Unfortunately, many of these same inequities can also be found in the fight against prostate cancer. As you all know, prostate cancer strikes 1 in 9 men. Even worse, Black and Latino men are 2.5 times more likely to die from prostate cancer than white men. Because of these troubling statistics, I am grateful for the work that AdMeTech does. The House has been proud to work alongside AdMeTech to promote awareness, education, and research. That's why the legislature increased the funding for prostate cancer research over the last fiscal year to $1 million. Through your advocacy work, AdMeTech recognizes that the way to make progress on this issue is to detect and treat prostate cancer early on. Specifically, the work that AdMeTech does to spread awareness about those who are more likely to develop prostate cancer is absolutely critical. While we can all do our part by talking with our doctor about getting screened for prostate cancer, the House will continue to do its part by legislating with the racial and health disparities in mind. I know that the House is committed to working with partners like AdMeTech to do our part in helping to spread awareness and to curtail the damage done by prostate cancer. So thank you again for including me in this discussion. I'm grateful for the efforts being made by so many of you.
Thank you, Mr. Speaker. Your ongoing support has been tremendous in the 13 years I've been involved with AdMeTech and all your years serving in the House of Representatives. Your unwavering support is critical to the work that we do here. So I also would like to shout out some of my former colleagues in the legislature. I see Representative Cabral, who works closely with the Greater New Bedford Community Health Center, where I am the CEO. And we have a large population of men of color, so we have patients who are at very high risk for prostate cancer. So his work and support of the health center is greatly appreciated. And in my hometown on Cape Cod, I see Representative Kip Diggs. So thank you both for the work that you do. And I see Senator Rush. Nice to see you here too. It is my great honor to introduce Senate President Pro Tem William Brownsberger, who represents Belmont, Watertown, and Boston, one of our event hosts today and has been for many years. And before you joined us, Senator, I was mentioning that I think you're the person that got me involved with AdMeTech. When I was the commissioner, you might have called me into your office and said this is a really important public health priority and introduced me to Dr. Stern. And once I met Dr. Stern, I was off and running, inspired by her commitment and expertise in this work. So thank you for being with us again, and thank you for your great support for public health.
Thank you. Like you, I've learned a lot from Dr. Stern, and I am grateful for her advocacy on this issue. I have the privilege, I believe, now of reading a proclamation from the governor, who's unable to be here today. So I will go ahead and do that. So this is the governor's proclamation. Whereas prostate cancer is the most common major malignancy, striking as many as 1 in 8 American men, and is the second most lethal cancer affecting Massachusetts men. And whereas prostate cancer represents a major health disparity, it is 2.5 times more lethal in Black men compared with non-Hispanic white men. And while prostate cancer is curable when detected early, 700 men in Massachusetts are expected to die from prostate cancer in 2022, while 5,670 new cases will be diagnosed in the Commonwealth, according to the American Cancer Society. And whereas the governor of Massachusetts is calling on the state's medical experts, advocacy, and grassroots organizations to continue to lead the charge in creating and expanding a new model of national and global leadership in prostate cancer awareness, education, and research. This leadership makes possible cutting-edge, evidence-based strategies for precision screening, diagnosis, and treatment from our world-leading hospitals to all men in our state and to end health care disparities. Now, therefore, I, Charles D. Baker, delivering his proclamation, Governor of the Commonwealth of Massachusetts, do hereby proclaim March 31st, 2022 2022, that is, to be Prostate Cancer Awareness Day, and urge all the citizens of the Commonwealth to take cognizance of this event and participate fittingly in its observance. Given at the Executive Chamber of Boston, this first day of March in the year 2022 and of the independence of the United States of America, the 245th, signed by His Excellency Charles D. Baker, by the Lieutenant Governor Karen Polito, and by the Secretary of the Commonwealth, Bill Galvin. God save the Commonwealth of Massachusetts. So it's my honor to deliver the Governor's Proclamation and to join in the sentiment it expresses in recognizing this important day. And again, to thank you for your leadership, Dr. Stern, Cheryl Bartlett, and all of my colleagues, Mike Rush, Jared Cassidy, and the others who are so important to advancing this cause, Bud Williams, in this legislature. Thank you.
Thank you so much, Will. I would like to acknowledge a few legislators who have been long-term supporters of our program in prostate cancer awareness, education, and research. Representative Consalvo, Representative Golden, Senator Brady, and Senator DiZoglio, and their staff. Thank you so much for joining us for this event. Again, it's a very special pleasure for me to introduce Representative Jerry Cassidy, who is Vice Chair, House Committee on Post-Audit and Oversight. Representative Cassidy is the event host, together with Senator Brownsberger, and the leading champion of the prostate cancer program statewide and in Brockton, Plymouth County, since his election in 2015. Jerry, please.
Thank you, Doctor. And at the top of the show, my prayers go out to you and your family in Ukraine. And that was just wonderful. And it's heart-wrenching that your family are being bombarded in Ukraine. So I just want to say that. I do want to thank the speaker and for his advocacy, and also Chairman Mikowitz. Whenever you go in to see Chairman Mikowitz, he is without a doubt truly supportive of the prostate cancer awareness program that we advocate for. I'd like to give a shout out to the NAACP here in Brockton. You know, President Phyllis Ellis, who is a phenomenal woman that is leading the charge, and my good friend Steve Bernard, who informs me all the time about the prostate cancer events here in Brockton. And April 27th, we have one. The Healthcare Committee, Leona Martin and Janet Trask, they are truly, without a doubt, wonderful for this event in Brockton. Just a couple of words. AdMeTech Foundation, jointly with Brockton NAACP and Good Sam Hospital here in Brockton, initiated prostate cancer awareness campaign in Brockton and Plymouth County in 2015. Before this program started, African American men in Plymouth County, including Brockton, had Massachusetts' highest mortality, and it was even higher compared to the state averages. However, by 2021, per National Center Institute, prostate cancer mortality in African American men, Plymouth County, decreased by 55% and is now significantly lower than state average. Between 2015 and 2021, mortality in white men in Plymouth County also decreased by 23%, to a lesser extent than in black men. And yet, white men's mortality is now also lower than state average. Between 2015 and 2021, Plymouth County has had significant reduction of disparities in prostate cancer mortality between black men and white men. This disparity are measures by the ratio of the mortality in black men divided by the mortality in white men. Prostate cancer mortality in black men was 2.7 times higher than in white men. The disparity ratio in prostate cancer mortality was decreased by 55% to 1.2 times higher in black men compared to white men. This prostate cancer disparity is much lower now compared to the statewide and national average. I'd like to thank the Brockton, the NAACP, Good Samaritan Medical Center for their hard work, and God bless the Ukraine and God bless America. Thank you.
Thank you so much, Jerry. And I just want to acknowledge Senator Lovely and Representative Madaro, who just joined us. Thank you. Thank you for joining us, and thank you for your long-term and strong support.
Great. Thank you. I'm pleased now to be introducing Senate Majority Leader Cynthia Crean, who represents Newton, Brookline, and Wellesley, a champion of creating and expanding the statewide prostate cancer program over the last decade. Thank you for joining us, Senator.
It's a pleasure to join you for Prostate Cancer Awareness Day and to reflect on all the incredible progress that has been made since we began marking this day 12 years ago. Thank you, Dr. Stern, for inviting me and for your tireless efforts to make prostate cancer a public health priority. The AdMeTech Foundation has been a leader in every facet of improving prostate cancer care in Massachusetts and around the world. Its research has led to the creation of dramatically improved diagnostic and therapeutic tools. But it's not enough to make breakthroughs in diagnostic and treatment. You also have to ensure that medical providers know about those breakthroughs. That's why the AdMeTech Foundation convenes a summit that educates thousands of providers about practices for prostate cancer care. But even then, it's not enough. You also have to make sure that men understand risk factors and treatment options, particularly in underserved communities, and that all men have access to the best care. That's why the AdMeTech Foundation hosts community workshops in areas with the highest rate of prostate cancer mortality, bringing experts who can share the most up-to-date information about risks, diagnosis, and treatment. And that's why the foundation launched the Prostate Cancer Equity Program, which improves access to cutting-edge clinical care for Black, Latino, and Hispanic men who are at a higher risk. Thanks to this comprehensive approach to prostate care, the AdMeTech Foundation is saving countless lives every year, and with all of our support, it will continue to save lives. I'm so proud to support the Foundation's work, and I'm in awe of all that it has accomplished. Thank you for asking me to come today.
Thank you so much, Senator Crean. Our next speaker is Senate Majority Whip Mike Rush, who serves as a commander of the U.S. Navy in the reserve component and represents Boston in Suffolk County and Dedham, Norwood, Westwood in Norfolk County. Senator Rush is a leading champion of the prostate cancer program since its beginning in 2013. Senator Rush, please.
Thank you and good morning. It is a pleasure, Dr. Stern, to be with you and Commissioner Bartlett this morning and to be able to have such a robust program. And you have been an incredible leader, and it is just an honor to be with you. I'd like to thank the Senate President, the Speaker, all of my colleagues in government who are joining in this program here today. I just want to offer a few remarks, and I've spoken in the past, but I think it warrants some repetition. But many may or may not know, as a veteran, I'm intimately aware of the terrific work that the Veterans Administration Hospital is doing. And I'd like to highlight a model of addressing prostate cancer care created by the VA with over 200,000 prostate cancer survivors. Prostate cancer, as we know, is the most common malignancy diagnosed among veterans, representing the most significant healthcare burden. However, over the last 6 to 7 years, research consistently showed that in equal access Veterans Health Administration, the disparities in prostate cancer mortality between African American and white men have been eliminated, and this is truly incredible. The patient outcomes were equal, irrespectively of the level of education or income. The VA model is directly relevant to Massachusetts with its universal access to care, and that's why I strongly support a statewide program in prostate cancer research education and awareness. If the VA could reduce prostate cancer mortality in African American veterans and related disparities with white veterans, Massachusetts programs will lead elimination of prostate cancer disparities for everybody. So this day is so important, voices being heard, action being taken, and I am honored and privileged to be with each and every one of you today. Thank you so much.
Thank you, Senator. Always great to have you with us and your strong support. It's my pleasure now to introduce Representative Carlos Gonzalez. He's the chairperson of the Joint Committee on Public Safety and Homeland Security. Good morning, Representative. He's the immediate past chair of the Massachusetts Legislative Black and Latino Caucus and a strong and long-term supporter of addressing health disparities in prostate cancer statewide in the greater Springfield area in particular. Thank you for being with us.
Thank you for having me, and buenos dias to everybody. Good morning. Dr. Fina Stern and Director Thomas, Satham, thank you for all the work you do. And again, to all the speakers here today, to the speaker who has led through the equity lens, and the Senate President, and to the whole AdMeTech team, I just want to bring greetings from the 10th Hampton District of the City of Springfield, which you play a major role in addressing the issues that we are here today. In the United States, prostate cancer is the second most common cancer in men, and after skin cancer is the second most deadly cancer in men, and after lung cancer. So we've heard so much of the statistics of how this is impacting us. I want to kind of just address a little bit of the hope and the work that you do, particularly here in Hampden County and Springfield, Massachusetts, with the workshops and keeping the importance of early detection, of getting to meet with your doctors as early as possible is so important. The disparities exist here in Massachusetts, as well as with the mortality rate among Black men being significantly higher than white men. You've heard that over and over, but unfortunately, Hampden County has the second highest mortality rate among Black men and the highest mortality rate, the highest of Latino men, Hispanic men in this state. So again, for the work that you do, extremely important is preventive measurement, and the state of Massachusetts has been putting their mouth where the mouth is, and providing the resources necessary to continue the great work that you do. I would like to thank everyone for the advocacy and supporting AdMeTech and making sure that we are saving lives and promoting health equity in Massachusetts. And I hope you all have a wonderful day. Thank you and muchas gracias.
Thank you so much, Carlos. Thank you for your support for years and years. Our next speaker is Representative Bud Williams, who is Chair, Joint Committee on Racial Equity, Civil Rights and Inclusion. He is a member of the Massachusetts Legislative Black and Latino Caucus and supporter of the prostate cancer awareness in Greater Springfield, Hampden County since his election in 2017. Representative Williams, please.
Thank you, Dr. Stern. Good morning, and our prayers go out to you and Ukrainian people. You're going to prevail. You're going to win this thing. You're going to fight. Thank you so much. Protocol has been set, and I just like to share into Senator Brownsberger, and to my classmate. I was in 215, and Cassidy's my classmate. And one of my first orders in the house was when I started communicating with him. We just hit it off. We just hit it off good. And he talked about this wonderful program that he was involved in, prostate cancer. And I've been involved with the Manogram prostate cancer on a local level, but he got me involved on a state level. And I want to thank Speaker Mariano and Senate President Spilka for securing that $1 million along with the governor. That's very important. And through the equity lens that I I view, I have to get a shout out to the men of Mocha in Springfield, who do amazing work. Matter of fact, they had a session last Saturday, which was the 26th, and now we have another session. We have a prostate breakfast coming up on April 2nd in Greater Springfield to deal with the Black and Hispanic men. And Lamont Scott, who will be speaking a little later. You got Bo Hubbard, you got Henry Douglas, Archie Emanuel, and the whole group of men of Mocha who are been on the ground for many years trying to, help eradicate this very deadly cancer. So, Dr. Stern, to you and Rep. Cassidy, she told me about that program in Brockton, and I check with Dr. Stern all year long, not just on Prostate Cancer Day. And that equity program, we're going to try to duplicate. We will duplicate it in Hampden County, and the amazing work you did with the NAACP and all the health partners, and you brought your numbers down. So the proof is in the pudding. So hopefully, Dr. Stern, we've talked about this, and we will absolutely do what we can do in Springfield. I would like to start by thanking AdMeTech Foundation for inviting me to be part of this event. I'm proud to be part of the Massachusetts legislature that has set up a historical precedent and recognized prostate cancer as a public health priority in all men and leading healthcare disparity in Black men. According to the American Cancer Society, prostate cancer will strike over 5,670 men and lead to 700 deaths in Massachusetts in 2022. In Hampden County, in my district, prostate cancer effects are unacceptable. According to the National Cancer Institute, Hispanic men have the highest mortality, and Black men have the second highest mortality of this disease. In our state, Black men and Hispanic men are almost twice as likely to die of prostate cancer compared to white men. This loss of our men is particularly unacceptable because early detection saves lives. I would encourage every man in general, but every Black and Hispanic man in particular who have reached the age of 40 to ask their doctor for prostate cancer screening with a simple blood test called PSA. This test may save your life. And Dr. Stern has educated me. Back a few years ago when men would go and I would go for my physical, prostate cancer screening was a part of your general physical. Now it's my understanding you have to make the request. The man has to make the request for the PSA. So we need to educate our men a little more. Together we can eliminate inequalities between Black and white men in prostate cancer in our community and our state and set an example for our nation. Thank you, and the best of luck. And thank you again, Rep. Cassidy, for all the hard work that you do. And Dr. Stern, thank you.
Thank you, Representative Williams. It's so great to hear that MOCA is alive and well. In 2009, I was charged with addressing health disparities in men of color here in Massachusetts, and Springfield, Worcester, Boston, Fitchburg, a few other places got resources to develop local advocacy. And it's really great to see that a couple of them are alive and well, even if some have changed their iteration and leadership. But MOCA has always been near and dear to my heart. So send my greetings to the men of Springfield. And I'm very pleased to now get to introduce Representative John Santiago, Vice Chair, Joint Committee on COVID-19 and Emergency Preparedness and Management, an emergency room physician at Boston Medical Center, Massachusetts Legislative Black and Latino Caucus member, and supporter of prostate cancer awareness since his election in 2019. Representative, thank you for being with us today. Thank you for the work you do at Boston Medical Center as well as the legislature.
Great. Well, thank you, Commissioner, for the kind introduction. Good morning, everyone. It really is a pleasure to be here. Let me first thank AdMeTech for having me and offering me the opportunity to share a couple of words, and to really thank you for all what you do. It's an honor to be here today. on this day to advance prostate cancer research and awareness. Thank you very quickly to the MCs and the host, particularly Senator Brownsberger and Representative Cassidy. It's been, I think this is the third time I may have spoken at AdMeTech, and it's always a pleasure to be here with each and every one of you, particularly Dr. Stern, who I count as a friend and an ally in this fight. I have this connection with Dr. Stern because we both come from the medical background, and we've both been able to transition our medical experiences, our expertise, into the political realm. And I think that is where the magic happens and where the real change is seen, because as we know, as physicians, we treat one patient at a time, but through policy change, through advocacy, you can treat so many more, and it's a very powerful thing. So I'm honored to be here and to be a supporter and a friend of Dr. Stern, because right now we know that in the Commonwealth, that our great cause is to address health inequity rather. And it's something that we've seen over the past 2 years, given the COVID-19 pandemic, what it's done. And I think for many of us in healthcare, we kind of knew what was going to happen. But for those of us who haven't necessarily been engaged in healthcare and working with our most vulnerable communities, what COVID-19 did was essentially take the lid off the top and really expose all these underlying disparities in health inequities. And it's important to realize that they exist and they are vast, and they exist within the realm of prostate cancer as well. Because we know prostate cancer, as has been said throughout today's presentation, it's incredibly prevalent. As Senator Brownsberger said, 1 in 8 men are impacted by prostate cancer, and if not detected, it can be quite deadly. Across the country, there are millions of men that are living with prostate cancer, and that's why it's important that we improve the accuracy, the efficiency, and the capability to diagnose prostate cancer as soon as possible, because it's about keeping patients safe. And we cannot forget that there continues to exist an issue with respect to equity. As has been said by Chairman Williams, Black men are twice as likely to die from prostate cancer. Too many individuals, particularly those of color, continue to fall through the cracks, miss appointments and screenings, which have all been made much more difficult with the COVID-19 pandemic. And I know so because as a physician who works in the ER, I see these patients coming in who have not been connected to the care that they need, that they deserve. And when it comes to prostate cancer, this delay can be deadly. And it's for that reason that I'm especially grateful for all the work that Dr. Stern, Thomas, and the rest of the crew of the AdMeTech have been doing, including the Brockton NAACP, because if prostate cancer is detected early enough, rest assured we can save lives, we will save lives, because the survival rate is incredibly high, but it needs to be detected. So if you're out there, go see a physician if you are an elderly man or in need of some care, and we will in the legislature continue to be strong advocates for prostate cancer and research, and it's really been an honor to support Dr. Stern in the House budget, and we look forward to doing so in the future. So thank you again for having me. I look forward to continuing to work with each and every one of you.
John, thank you so much for your support and for being here with us. As you mentioned, it's very special for me to have a colleague at the State House who I am a data freak, and I love sharing all the data with you. Thank you so much for your support. I would like to acknowledge a couple of legislators who join us. Senator Feldman, thank you for being here. Thank you for your support. I want to give a particular shout out to Representative Honan. This event is dedicated to the memory of Nak Vaisaki, my father. And Representative Honan has been a friend for our family much longer than I can possibly remember. And it was actually Representative Honan who introduced me to the key members of the Massachusetts legislature at around 2008, 2009, and encouraged me to create Prostate Cancer Awareness Day at the State House. Representative Honan, thank you so much for everything you do, everything you did, and you, I'm sure, will do. Not only for prostate cancer, but also for my family. Thank you for your friendship. Actually, our next agenda item is to introduce prostate cancer equity program, which is a new program for Massachusetts. As you know, as many of you know, in the past, AdMeTech Foundation relied on our prostate cancer program on awareness, on public awareness and community education, medical education. We are today launching prostate cancer equity program together with our partners in clinical community, outstanding leading clinical experts, including Dr. Adam Feldman of Massachusetts General Hospital, who is also urology expert to my family, Dr. Mitchell Sokolov of UMass, and Dr. Kwok-Ding Trink of Brigham and Women's Hospital. Bill, if you can please demonstrate my video. We ask everyone to provide videos in order to avoid internet instabilities and related problems. Welcome to the 13th annual Prostate Cancer Awareness Day, honoring memory of Nak Vaisaki, my father, who had prostate cancer and dedicated his life to improving lives of the underprivileged, particularly refugees, immigrants, and elderly individuals. This event is organized by AdMeTech Foundation in cooperation with members of the Prostate Cancer Action Council, including American Cancer Society Cancer Action Network, Center for Elimination of Health and Social Inequities and Disparities, or SECSID, Community Health Awareness Network, or CHEN, Latino Health Insurance Program, or LHIP, Massachusetts Prostate Cancer Coalition, or MPCC, Men of Color Health Awareness, or MOCA, New England Area Conference of NAACP, and our independent Blue Ribbon expert panel consisting of the leaders of clinical care and research. This event is an integral part of the statewide prostate cancer program that's created a Massachusetts model of national leadership in public awareness, medical education, research, and reducing health disparities. I want to express my gratitude to many Massachusetts legislators who have made it possible to establish and expand this program since 2013. The priority focus of our program is on high-risk men, particularly African American, Hispanic, and Latino individuals. While we are dealing with COVID pandemic, prostate cancer cannot wait. Timely care is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die of prostate cancer compared to white men. These disparities are particularly unacceptable because prostate cancer is curable when detected early. Unfortunately, many men stopped visiting clinical facilities out of fear to contract coronavirus. Delays in care can cause reduced quality of life and even loss of life. It is important to highlight that clinical facilities created a safe environment for prostate cancer care, including telehealth for virtual visits, ongoing in-person care, and medical procedures, including biopsies and treatment. Medical education is the second component of our program. Annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer was established in 2016 and took place virtually in September 2021. This event is unique since we took down the silos and brought together the key international opinion leaders of each subspecialty involved in prostate cancer care. Our summit has made a decisive impact on medical education as well as the state-of-the-art and future vision for patient care. Last September, we had over 250 attendees. Our media partner, Grand Rounds in Urology, a prestigious online publication, brought this information to over 15,000 physicians located across the globe. Each year, we also develop a consensus statement on emerging best clinical practices and research priorities. It has been rewarding to see adoption of our consensus recommendations by the National Comprehensive Cancer Network extensively represented at our summit and consisting of more than 28 leading cancer hospitals. This organization develops clinical practice guidelines setting the standard of patient care nationally and internationally. Our summit showed rapid advances in screening, diagnosis, and treatment. And Drs. Feldman, Trink, and Sokolov will describe them in detail. On one hand, these advances have been emerging so quickly over the last several years that even experts have difficulties keeping up with the evolving knowledge or getting access to the related innovations. On the other hand, recent data from veteran administration and military medicine show that with equal access to care, white and black men had equal outcomes, including equal probability of death. Based on this evidence, our health disparity panel concluded that the equal access to care is the single dominating factor in achieving health equity. It is important to note that Black men are at higher risk of both the death and unnecessary procedures. Consequently, it is critical to have access to precision diagnostics that determine for each individual man if he should or should not have invasive biopsy or invasive treatment. In addition, recent data indicate the importance of imaging such as MRI in Black men who are more likely to have prostate cancer lesions in the front of the prostate, which is not accessible by physical exam or standard blind biopsies without accurate imaging. Our health disparities panel also highlighted that nationwide, up to 40% of Black men do not undergo life-saving treatment they're recommended. We believe that in Massachusetts, with its leading hospitals and universal access to care, we will be able to eliminate health disparities. Today, jointly with Dr. Adam Feldman of the Massachusetts General Hospital, Dr. Kwok-Ding Trink of the Brigham and Women's Hospital, and Dr. Mitchell Sokolov, University of Massachusetts, we are launching a prostate cancer equity program in our state with the mission to save lives and deliver high-quality care for all. This program will help men to find prostate cancer experts for a primary or a second opinion. We have a process in place to expedite virtual or in-person medical visits, and we'll be working with men on the appropriate follow-up and implementation of clinical recommendations. Our doctors are leading experts who ensure the most advanced approaches to screening, diagnosis, and treatment of prostate cancer available today. As mentioned earlier, prostate cancer striking 1 in 8 men is the most common and the second most lethal male cancer. Any Massachusetts man age 40 and older can take part in our program. Our priority focus is on African American, Hispanic, and Latino men who are at higher risk of prostate cancer, delayed diagnosis, poor quality care, and death. Clinical experts of the Prostate Cancer Equity Program can address any questions about your prostate health. Are you concerned about your individual risk of prostate cancer? Are you interested in cancer prevention and early detection critical for saving lives? Do you need more information to decide if screening with PSA blood test is right for you? Do you have questions about your screening results? Would you like to learn more about advanced non-invasive blood and urine tests before getting invasive prostate biopsy? If you are diagnosed with prostate cancer, would you like to know what treatment options may be right for you? Did you experience side effects after biopsy or treatment? Did you have treatment already and have questions about the appropriate next steps, including prevention or early diagnosis of cancer return or progression? To ensure successful implementation of the Prostate Cancer Equity Program, we have created a network of participating leading state experts in patient care with the most advanced resources in screening, diagnosis, and treatment. Developed a process for patient referral to expedite medical visits and ensure appropriate follow-up. Mobilized community coordinators. In particular, I'd like to thank Steve Bernard, immediate past president of Brockton NAACP, and Kathy Ann Reddick, immediate past president of Cambridge NAACP. Steve and Kathy Ann created a network of over 55 program ambassadors who are leaders of the community organizations and churches with extensive networks of their own. Our community coordinators and program ambassadors participated in multiple focus groups and helped us develop culturally appropriate program materials. We are currently working with multiple community partners, program ambassadors, and health centers to notify men, their primary doctors, and caregivers about this program. If you're interested to take part in this program or have questions, please contact Summer Mills at 617-523-3535 or email coordinator@AdMeTechFoundation.org. I'd like to express my gratitude to our sponsors who made this event possible. We are proud that our sponsors are leading the battle against both prostate cancer and COVID-19. Platinum sponsor, Lantheus. Gold sponsor, Philips Royal. Bronze sponsors, Johnson, J&J, and Sanofi. Our event team includes AdMeTech staff and interns led by Thomas Satam and Ali Adam. Event management led by Nancy Petkunas for the last 13 years. And technical support led by Bill Wynn for over 10 years. I'd like to invite everyone to join us for the next Global Summit taking place virtually in September this year. Thank you for your attention.
Oncology Fellowship. Dr. Feldman is a co-founder of the Prostate Cancer Equity Program and will present recent advances in prostate cancer diagnosis. Pleasure to have you here with us, Doctor.
Good morning. My name is Adam Feldman. I'm one of the urologists focusing on urologic oncology at Mass General Hospital in Boston, and I'd like to thank the governor and all of the members of our state government for supporting all of the men in the state who are at risk for or have prostate cancer. Your contributions are incredibly valuable and important to all of the work we're doing and to caring for these patients. I'd also like to thank Dr. Faye Stern and AdMeTech for all of their devotion to these men and to our patients. And I'd like to just give a little bit of introduction. There's a few of us who are going to be speaking about prostate cancer, and I'd like to give a little introduction. So prostate cancer is the most common cancer in men, with over 268,000 cases expected in 2022. It's the second most common cause of cancer death in men, with over 34,000 deaths in 2022. This is in the United States. And about 1 in 8 men will develop prostate cancer. So if we look here, this is just a chart to talk about sort of what's the incidence of prostate cancer and what has it been over time and what has been the history of prostate cancer screening and detection in the United States. And this is very important and critical actually to moving forward and trying to take care of men at risk for prostate cancer. So this is looks at the rate of prostate cancer, the incidence over time from 1975 to beyond 2015. And here, what we can see is that the incidence of prostate cancer actually with the start of PSA went up. And then there was a cull effect where we identified those cases, remained pretty stable through the sort of late 90s and early 2000s when PSA testing was really being used. There has been controversy about PSA, by the way, as the blood test that we commonly use to screen for prostate cancer. And then in the late 2000s, based on some data that was, there was some controversial data, I would say, it fell out of favor in terms of being used based on some recommendations. And as you can see, the incidence of prostate cancer went down, and that's because it wasn't detected. This looks at mortality of prostate cancer. and deaths due to prostate cancer. And this is at the start of screening for prostate cancer, in which you can see that the mortality over time as we screen for prostate cancer also went down. So I mentioned that time in the sort of late 2000s to around 2011, when there was a recommendation for getting away from PSA testing or screening for prostate cancer. And what we've learned since that decision occurred was that actually we are seeing prostate cancer diagnosed at later stages and slightly more advanced cases. And so it's evidence to support how important it is to screen men for prostate cancer. And usually we think within the age, 45 to 75 in terms of the timing for screening. So there are a number of different ways to the basic test for prostate cancer screening that we have now, and that really has been since the early 90s, is a blood test called PSA. I mentioned that, what's called prostate-specific antigen. And I'll just comment, I don't have a lot of time to go through details, but there are a number of different other biomarkers that we've made a lot of advance in, and biomarkers being ways to detect tests in the blood, tests in the urine, and some tissue-based tests that we use to assess men for prostate cancer, and then further help to stratify their risk for prostate cancer and then risk for significant prostate cancer. Other improvements that really have taken off in the past several years have been improvements in imaging. This is an example of prostate MRI, which now really has become standard in assessing men for after they've been diagnosed, but even before having a biopsy. And then what we can do is we can now use that information of the MRI and combine the imaging of the MRI with an ultrasound that's done at the time of the biopsy to make our biopsies more accurate. And what we found actually is that using MRI for the diagnosis of prostate cancer and to assess men with prostate cancer actually can improve care by potentially avoiding biopsy in many men, and then also improving our ability to identify cancer, prostate cancer, that would otherwise have affected them in their lifetime. So another great improvement in prostate cancer care and the detection of prostate cancer, which is actually quite recent, is trying to make our biopsies safer. And so we historically have always used what's called a transrectal approach, and a transrectal with a biopsy needle goes transrectally. But actually now many of us have transitioned entirely to what's called transperineal biopsy, which is safer for men by reducing the risk of infection, reducing many of the reasons why men might have to go to the emergency room after this procedure. That risk was low to begin with, but this is significantly lower and a significant improvement. We also have seen major improvements in imaging for prostate cancer, and not just MRI, but also imaging for metastatic disease. And PSMA, or prostate-specific membrane antigen, PET scan, is a great example of this. And this is recently FDA-approved imaging agent in order to improve the staging and improve detection of metastatic disease in men with prostate cancer and improve our care of them. So there are many different options for management of prostate cancer once detected. That will be discussed later. So I don't want to go into the details of that, as my colleague will discuss that. But as we think about and go through the morning, really what I'd like to just make sure everyone understands that prostate cancer remains the most common malignancy and second most common cause of cancer death in men. Screening and detection is important, and PSA testing remains the standard, although there are a number of different new diagnostic tests on the horizon. In addition, there's a number of different imaging modalities on the horizon that we know will improve care for men in the future. Access to these advancements in screening and diagnosis is critical in all communities. And Dr. Trin is going to talk about our prostate cancer equity program, which we're really thrilled to discuss, funded at MGB through the United Against Racism campaign and in partnership with AdMeTech and others here today. So thank you so much.
Thank you so much, Adam. And thank you for your partnership in prostate cancer equity program. I would like to acknowledge presence of two remarkable individuals, Representative Minnie Cucci and Representative Ferguson, again, long-term supporters of our prostate cancer program. Our next speaker is Dr. Mitchell Sokolov, professor and chairman of urology, University of Massachusetts Medical School. Dr. Sokolov is an active supporter of prostate cancer awareness statewide, as well as in Worcester and Hampden counties. He is one of the original participants of the Prostate Cancer Equity Program and will present recent advances and treatment.
Good morning. I'm Dr. Mitchell Sokolov. I am professor and chair of urology at the University of Massachusetts Medical School and chief of urology at UMass Memorial Health. It is a pleasure to participate in this year's prostate cancer awareness program at the State House. I wish to commend Dr. Stern and her team for putting together an outstanding program. I'm also honored to be a partner with AdMeTech in their prostate cancer equity program. This initiative aligns perfectly with the anchor mission and strategic priorities of UMass Memorial Health. One of our goals is to improve the health of our region by addressing social determinants of health and ensuring equitable care for all. We all know that there are longstanding racial and ethnic disparities in prostate cancer care. Initiatives such as the Prostate Cancer Equity Program are desperately needed to correct this. This is especially true in Worcester County. Black and Hispanic communities comprise 28% of the population and are at the heart of our clinical practice. That puts Worcester at ground zero with some of the highest prostate cancer incidence and mortality rates in Black and Hispanic men in Massachusetts. Several research projects initiated when I arrived at UMass 8 years ago showed decreased prostate cancer awareness and screening and a lack of prostate cancer providers in central Massachusetts. This had a disproportionately negative impact on Black and Hispanic communities. We intervened with outreach and educational programs. We increased access to our specialists. We increased the number of specialists, and we continue to provide top-of-the-class, state-of-the-art diagnostics and therapeutics for all of our patients. This includes targeted biopsies, the most advanced surgical robotic and minimally invasive procedures, and the most up-to-date administration of radiation therapy. Soon, we hope to offer focal therapy in addition. Our approach has shown success, and Worcester County is one of the only counties in the state in which prostate cancer mortality is declining. In addition to our collaboration with AdMeTech, we maintain a close partnership with our institution's Office of Diversity as we continue to address both the social and political determinants of health. For those of you not familiar with the political determinants of health, it is a field created by Daniel Dawes, who is director of the Satcher Health Leadership Institute at Morehouse University. The political determinants of health focus on how politics can influence the social inequities that thereby impact healthcare disparities. For anyone who's not familiar with Dr. Dawes' work or his books, I encourage you to read them. Therefore, in order to build a statewide and hopefully a nationwide model for providing equitable prostate cancer care, there needs to be strong and unwavering support from all levels of state and local government to support the frontline prostate cancer providers and the state's safety net academic medical centers. Massachusetts has always been a leader in the nation in prostate cancer care. AdMeTech's new model for prostate cancer equity will continue to provide Massachusetts with a leadership role. Thank you for inviting me to speak. I believe there's time to answer questions a little later in the program.
Thank you, Dr. Sokolov. Great to have you with us year after year and all the work that you're doing. And it's great to have this new concerted focus on disparities and equity, really an important part of the work for prostate cancer. And next we have with us today Dr. Kwok-Din Trinh, Associate Professor of Surgery, Brigham and Women's Hospital, Harvard Medical School, Co-Director, Dana-Farber Brigham and Women's Prostate Cancer Program, and Director, Ambulatory Clinical Operations, Division of Urological Surgery, and co-founder of the Prostate Cancer Equity Program. Thank you for joining us, Dr. Trinh.
Hi, my name is Kwok-Din. I'm a urologist at Brigham and Women's Hospital and an associate professor of surgery at Harvard Medical School. I want to talk today about promoting equity by improving access to prostate cancer care, and specifically our newly launched Prostate Cancer Equity Program in collaboration with AdMeTech. Here are some of my disclosures. So if we talk about mortality from cancer, the big picture, we come to realize that there is a gap, unfortunately, between Black individuals presenting with cancer and white individuals presenting with the same cancer. That gap varies from one cancer to another. There's not that much of a difference in the world of lung cancer, but it's pretty significant in terms of prostate cancer and breast cancer. What is concerning, though, is that for breast cancer, there's a clear biological explanation, whereas for prostate cancer, there is not. And why is there such a gap is an important question. The other issue here is that the gap between minority patients and white individuals has pretty much narrowed down in most cancers, but it has largely remained unchanged between Black and white individuals presenting with prostate cancer, which again is quite concerning. If you consider this study, which was published a couple of years ago, a provocative study that our group did, we come to find that if you do unadjusted, just look at mortality of Black men and white men presenting with prostate cancer, you find that 27% gap. Black men are 27% more likely to die. But when you start accounting for other factors, including demographics, including access to treatment, the difference becomes much more small, to a point where Black men may even do better than white men presenting with prostate cancer, as long as they have access to treatment and accounting for other demographics. And what's also important to consider here is that even in our great state of Massachusetts, this study that we did, and in collaboration with the Massachusetts Department of Public Health, found that Black men are unfortunately 22% less likely to receive treatment for prostate cancer, even when this cancer merits treatment. So how do we put this all together? And this is the project framework of the Prostate Cancer Equity Program. On one side, there are disparities, and biological differences, while important, may not be the main driver explaining the gap. And then we have shown also that access to care, and specifically access to treatment when indicated, is a key component of reducing that gap. So the whole idea of this project is that potentially we can reduce disparities, we can close the gap by increasing access to treatment for minority populations. So what does this prostate cancer equity program consist? We are directing this program to minority populations of Massachusetts specifically. We hope to achieve that with patient education, marketing, outreach, and safety net initiatives. And what are we trying to give to this population? We want to provide the best prostate cancer care to minority populations through our academic and upper community partners as a means to obtain a second opinion. And in the long run, through synergies and investments and fundraising, we really want to make this a comprehensive program and increase minority volume of prostate cancer patients treated in the short term, and eventually potentially even decrease the mortality of prostate cancer in the great state of Massachusetts. So in summary, this is the Prostate Cancer Equity Program, and we hope to be able to partner with everyone and every stakeholder to deliver together better prostate cancer care for all in Massachusetts. Thank you for your time.
Thank you so much, Kwok. And thank you for your partnership in Prostate Cancer Equity Program. Our next section is dedicated to cutting-edge innovations in prostate cancer care. I would like to introduce two representatives of Lantheus, our platinum sponsor, Dr. Daniil Kuftinek, who will review PSMA molecular imaging, some of the most recent additions to the armamentarium, to the imaging armamentarium we have. This imaging had become available in Massachusetts only since as recently as August 2021. It was also mentioned by Dr. Feldman as one of the most significant and exciting developments for men with prostate cancer. Dr. Kuftinek, please.
Hi, good morning. I'm Daniil Kuftinek. I'm Medical Director of Global Medical Affairs at Lantheus Medical Imaging and a urologist. And I'm honored to be here. I wanted to thank AdMeTech for this opportunity. And I'm here to speak about the very exciting topic of PSMA PET-CT prostate cancer imaging. I do have to just before I get started, share some brief information about some product insert information for important risk and use information. Please see the full prescribing information. And these are just the following slides. So today, I'd like to just cover the general use of imaging in the management of prostate cancer. And then I'd like to specifically discuss the role and utility of PSMA PET-CT in the management of prostate cancer. And then I'd like to highlight through some case studies the relevance and use of PSMA PET-CT for initial patient management and for detection and localization of recurrent prostate cancer. And these will be some case studies. So the why, when, and how of prostate cancer imaging. So why? Well, we image because it provides information about prostate cancer distribution. And this can tell us if the cancer is localized, is it advanced or metastatic? It can tell us about the extent of the disease. If it's metastatic, is it limited, meaning oligometastatic, or is it widely disseminated? It can give us a sense of tumor biology. And since we're talking about PSMA PET-CT, it can give us a sense, is it PSMA avid or sticky? And then it can also ultimately give us information to share with patients regarding their prognosis. The when of prostate cancer imaging is typically upon initial diagnosis and at recurrence. And this is both for staging and treatment planning in both circumstances. And we use this as a part of risk assessment and determine the extent of disease, as I mentioned above. We also image to assess response to therapy and assess the targeting of new drugs. So how do we image for prostate cancer? Well, conventional imaging used for prostate cancer has included CT, MRI, and bone scans. These imaging modalities, however, may miss some locally advanced and metastatic disease in newly diagnosed patients. They can also be less informative about persistent local disease and metastatic disease in patients who have recurrent prostate cancer. There is, in this slide, it's a depiction of the natural history of prostate cancer. And I call to your attention this sort of red roller coaster line that represents PSA or tumor volume over the lifetime of a patient with prostate cancer. In the primary treatment setting, we know that about 30 to 50% of men who undergo treatment with curative intent, meaning surgery or irradiation, can develop a recurrence of their cancer in about 3 to 5 years. And that's sort of this left side of the graph. You see we're local therapy, and then this decrease in the red line, and then this uptick. And that makes us question, are we not selecting patients properly? Are radiation or surgery not effective? It's most likely selection, where conventional imaging isn't really capturing the full extent of disease at presentation that's contributing in part to these recurrence rates. In addition, as we follow this red line out into the recurrent setting, we can see that even at very low PSAs, that can be indicative of disease recurrence. And these are the patients that require early intervention to salvage and offer potential cure. Again, it's likely in these situations that conventional imaging is less informative about locally persistent or metastatic disease. And that's where the role and utility of PSMA PET can come in. So just a little primer about PSMA, or prostate-specific membrane antigen. As this cartoon shows, PSMA is basically an intracellular protein in normal prostate tissue, and that's sort of the left side of this green cartoon here. However, it becomes overexpressed, and it moves to the surface of prostate cancer cells, obviously when there's cancer. PSMA can therefore be a target for agents to bind to on the surface of the cells. And of note, there is some, and we can see this later on in the presentation, there is some limited expression of PSMA in normal tissues, such as salivary glands, lacrimal glands, kidneys. So, positron emission tomography, or PET, is a nuclear imaging technology that enables visualization of metabolic processes, and this is important, at the cellular level. The basics of PET imaging is that the technique detects gamma rays emitted indirectly by a positron emitting radionucleotide. And this is also called a radio tracer. The radio tracer, such as a PSMA agent, is injected into the patient's vein. It then travels through the body and it sticks to its target. Again, in this case, it would be PSMA on prostate cancer cells. PET systems then have sensitive detector panels to capture the gamma rays that are emitted from the radio tracers inside the body. And then they use software to triangulate the source of these emissions and create these beautiful 3D images of tracer concentrations within the body. Because PET agents can identify changes at the cellular level, so changes in tumor function as opposed to just tumor size, they can be very effective at detecting disease prior to conventional imaging. This butterfly side here represents an exciting direction that prostate cancer management is sort of heading in. And what it shows is the two bar graphs on the left-hand side. You can see that the color coding is consistent with the patient population. These are the traditional treatments for prostate cancer. So the mustard is patients who had undergone radical prostatectomies, and then the green is the patients who had gone radiation therapy. And what we're seeing is that traditional imaging, those patients move in these bands over to traditional treatment modalities. Either it's hormone therapy or radiation, a combination of the both, chemotherapy. But then after, with PSMA PET-CT scanning images, you can see that these bands move in with much more fluidity, and there's much more availability to what they're offered as far as treatments. And these can include things like targeted radiotherapy, salvage radiotherapy, a combination of the both, focal surgery, focal radiotherapy. So before I go into the sort of the cases, I just wanted to talk about how we got to using the role of PSMA PET-CT. And there are two trials just to highlight. The first is the Osprey Trial. And this was a multi-center prospective trial that was looking at patients, two different cohorts of patients. And I want to focus on cohort A. And these are patients with prostate cancer that was initially diagnosed. And what we found in this, which is the most exciting sort of results, is that even at low PSA levels, PSMA PET-CT was able to find metastatic sites or advanced prostatic sites with cancer that traditional imaging was not able to find. And that's most well highlighted on the right-hand side. You can see the skeletal images on a traditional bone scan, and it's negative. And then if you look to the right of that, there's also the PSMA PET scan, that same patient, and it shows significant upstaging between the two. The other clinical trial that I wanted to mention is called the Osprey Trial. And there's some theme here between the two. And then the Osprey Trial looked at men with the Osprey Trial looked at men with biochemical resistant prostate cancer. And what this found was that there was a change in management in these patients when we looked at their PET-CT scan compared to traditional imaging here. And the change in patient management, I think that this is a very illustrative slide. about 64% of the patients who were evaluated actually had a change in their management after having a PSMA PET CT scan. And 79% of those changes were after having a positive PET CT scan. But what's really interesting as well is actually 21% of the patient had a change in their management after having a negative PET CT scan. So you can see how PSMA PET can actually give patients more accessibility to different treatment options than conventional imaging. So on to the case studies. These are a couple of patients with newly diagnosed prostate cancer. So the first one is a 72-year-old male, again, newly diagnosed prostate cancer, a low PSA, 5.4, Gleason score of 8, and he was actually planned to undergo a prostatectomy. But in discussion, he had a PSMA PET scan performed for further evaluation. And this PSMA PET scan showed a right pelvic lesion and a right rib lesion, and that's seen with these red arrows here. And the CT-guided biopsy was performed of the right fourth rib lesion. It's sort of a high anterior rib lesion there. And that's seen by this red, I don't know if you can see my cursor, there's this red arrow here, and then this white streak artifact is actually the CT guided biopsy. And that did show metastatic prostate cancer. And this patient's management was changed from planned surgery to systemic therapy. Another newly diagnosed prostate cancer case, again, a 72-year-old male, newly diagnosed cancer. PSA, once again, relatively low, 5.2. His pathology also was a Gleason 8, and he also was planned for a prostatectomy. And this patient's PSMA PET CT scan showed 3 bone foci, and those can be seen with these red arrows here. The most prominent is this most distal one here in the left pubis, and that lights up very nicely on these fusion sagittal cuts of the PSMA PET CT. Again, this white streak artifact is the CT-guided biopsy, and the lesion did confirm metastatic prostate cancer, once again changing the treatment course from surgery to systemic therapy. This next case is actually a recurrent prostate cancer patient. He is a 65-year-old male. He had surgery, a prostatectomy in March 2018, and then he had salvage radiation therapy. His PSA, after declining, had risen to 0.6. And for evaluation of this, he had a CT scan and a bone scan performed, both of which were negative. But he went on to have further evaluation with a PSMA PET scan. And this PSMA PET scan shows an isolated left obturator lymph node. And that can be seen here with the red arrow, and then also here on the fusion studies, sort of really lights up. He underwent a CT-guided biopsy of this left obturator node, and it showed metastatic prostate cancer. And what's important for this is then he was able to be treated with focal radiation to the left pelvis, and his PSA nicely decreased to 0.2. This is a patient that might not have had focal treatment. He might have had systemic treatment as opposed to being able to actually treat the lesion if he had not had an opportunity to have a PSMA PET CT. And then the last case is also recurrent prostate cancer, and this is a 72-year-old male. Again, he had a prostatectomy in June of 2017, and then he had radiation in 2019. His PSA increased to 0.9. He had a CT scan and bone scan performed for further evaluation, both of which were negative. And he had a PSMA PET CT to evaluate his rising PSA. And this PSMA PET scan showed multiple subcentimeter nodes in the chest, abdomen, and pelvis. It also showed a vertebral lesion, T7, and that's lit up here on the fusion. That was biopsied and again showed metastatic prostate cancer. And he started treatment with abiraterone systemic therapy. So that is the conclusion. I'm happy to take any questions. And once again, thank everybody for their time and the ability to participate today.
Thank you very much. Very interesting information. Thanks for joining us today. I'm going to introduce now Dr. Ilya Gipp, who is here representing Philips Royal, and she will review the latest advances in patient information management or bioinformatics. And she is an expert with global strategic account executives at Philips Royal. Thank you for joining us.
Hello, my name is Ilya Gipp, and I'm the medical officer for oncology in Philips. What I would like to do is to use the next 5 minutes to demonstrate a few things that, in my view, may improve prostate cancer care. And in order to make it excellent, I believe it needs to be more accessible, seamless, and also patient-centric. Let's look at the example of the end-to-end prostate cancer care, starting from early detection and all the way into home care and follow-up. We used to think that early detection, including screening, precision diagnostics, and also personalized and adaptive therapies should be sufficient. And this is partially so. But along the way, we have so much data. We have so many different tools, different professionals that are involved. It becomes very difficult to keep patient in the center of it. Therefore, what I would like to do is demonstrate a few examples of seamless clinical insights along cancer care, accessibility, and also patient engagement, involvement, and navigation. Let me start from accessibility. One of the most expensive modalities that can contribute to better prostate cancer care is the MRI. 20% of helium consumption worldwide is done by MR scanners, and that contributes greatly to the price of the MR and operating the MR. There is technology that today allows to use only 0.5% of helium that was once necessary for any MR scanner, and that allows hospitals to start saving money. Making it more accessible to hospitals, we also make it more accessible to patients, and especially the underserved population that may benefit by having MR in their prostate cancer care. Here is an example of a speed and a great diagnostic confidence that MR can deliver. A great image that is acquired in 4 minutes can now be done in less than 3 minutes, which also brings ability to have more patients done, to examinations to be done faster, and deliver the first time right high-quality imaging for each and every patient. It is not just the diagnostic stage, but it is also breaking silos. Here is an example of radiology, urology, and pathology. Because at radiology stage, multiparametric MRI, PIRADS scoring and reporting is being done. Then MR data sets can be transported and exported into urology departments along with target segmentation so that during transrectal ultrasound scan, targeted MR and ultrasound fusion biopsies can be performed with better precision and with better targeting at the lesion that we need. And then the biopsy samples, tissue samples, are traveling to pathology department that there can be digitized, reviewed, digital consult can be performed, and eventually Gleason scoring is going to be done a lot faster. And if all together, this brings us to a more collaborative way of checking data correlation and making the best possible decision for the patient with the help of the IT tools, all of a sudden, all of these departments that are geographically separated start to act as a whole to bring more actionable insights, more efficient workflow, and eventually a better prostate cancer care. Here is an example of the use of MR also replacing the conventional CT in planning radiation therapy. Now, this is the CT, and the seminal vesicle is being delineated by the CT data, by the use of CT data. Introducing MR, you can see how much better the contours become so that we can preserve the organ better, that we can target better and make radiation therapy more precise, more personalized, safer, and more efficient. Let's not forget about patient engagement and experience. There is so many steps that patients can benefit by being more involved, by being aware, by being better navigated. And along the way, so we have technologies today that allow to stay connected with the patient and make sure that there is real-time feedback, that all patients' concerns are being also taken care of. At the end of my 5-minute presentation, I would like to shortly give a summary. That connected prostate cancer care service line, it includes data acquisition, it includes data deployment, but along the way, a very important step of data integration and orchestrating everything in a meaningful way, I think is ultimately what's going to get prostate cancer care service lines even better. And with this, I very much thank you for your attention.
Thank you so much, Dr. Gibb. We will proceed with the next section of our program called Transforming Personal Experience with Prostate Cancer into Public Service. We will hear from prostate cancer survivors who became prostate cancer warriors. The first speaker is Juan Caulfield, President, New England Area Conference of NAACP, and the key AdMeTech's partner in the Prostate Cancer Action Council.
Good afternoon. I'm Juan Caulfield, President of the New England Area Conference of the NAACP. I am delighted to be here with you this afternoon to promote the issue of prostate cancer awareness. Governor Baker, President Stoker, Speaker Mariano, I am so delighted and appreciative, and the NAACP is appreciative of your understanding of and support of prostate cancer awareness and AdMeTech Foundation's program for prostate cancer awareness. I also want to give special recognition to my state senator, Mike Rush, and Representative Jerry Cassidy. These legislators have done an outstanding job of advocacy for prostate cancer awareness and the program of promoting awareness in the Commonwealth in a program under the leadership of Dr. Stern. I can't say anything but praise Dr. Diana Stern and AdMeTech for the wonderful job that AdMeTech has been doing in the promotion of prostate cancer awareness. What we know is that early detection is brought about by prostate cancer awareness, and early detection and early treatment, appropriate treatment, leads to a reduction in the incidence of prostate cancer, the hideous disease of prostate cancer. The New England Area Conference is delighted to be working with AdMeTech Foundation in the promotion of greater awareness of the issue. I want to tell you a personal story because I think it's appropriate in this setting. I am a prostate cancer survivor. I found out very early that I had prostate cancer. I was unaware of the issues around prostate cancer, but my general practitioner understood and knew, and also knew the propensity for greater incidence of prostate cancer among African Americans. And he started testing me very early with the PSA. And he saw it rising and alerted me and sent me to a urologist. I was treated. That was about 16 years ago. I am healthy, at least I think I am. And it's been, the prostate cancer has been arrested. That's the story. And this has convinced me, my personal experience with prostate cancer has convinced me to become actively involved and to see that prostate cancer awareness is a priority for the New England Area Conference in our health advocacy. And I'm appreciative of that. Prostate cancer does affect to a greater extent, proportionately, African Americans and Latinos than white men. However, white men do get prostate cancer awareness also. I don't want anyone to leave here thinking that it's just African Americans and Latinos. All men should be, depending on what category you're in, well, first, all men should be aware of prostate cancer. And depending on which category you're in, whether or not you're in a high risk category, and your doctor can tell you that, you should be tested at the time that your doctor would suggest. And I want to say also something about women. Even though women don't get prostate cancer, women play a very important role in the lives of most men. And many men have a sort of a macho attitude about taking care of their health. And so we ask women who have loved ones, male loved ones, to urge them to get tested. And these loved ones can be their husbands, their fathers, their sons, nephews, boyfriends, but we involve women in our program of prostate cancer awareness and ask them to stay on the male loved ones in their family and make sure that they understand the issues and are being tested for prostate cancer. I want to thank you for the opportunity to talk to you for a minute or two about prostate cancer and the importance of getting of early detection and appropriate treatment. Thank you so much and have a good afternoon.
Thank you, Juan, for joining us today, for your comments and also for many years of commitment to AdMeTech and prostate cancer awareness. And now I have a privilege of introducing the next guest, someone who I call a friend and a colleague. That is Dean Harold Cox. He is the Associate Dean for Public Health Practice and a professor of community health sciences at Boston University. Served on the Public Health Council for many years at the Department of Public Health, and our career paths have crossed many times over the decades. So wonderful to see you, Harold.
Hello, Cheryl. I'm glad to see you, and indeed, I do call you my friend. I'm glad to see you. I'm glad to also be here today because it's so important that as we are listening about data and understanding about treatment, it's also important to hear about the individual stories that individuals have as well. Telling our stories is important. Telling our stories so that others can hear is important. I went to my doc some number of years ago for my regular checkup, and we determined that I actually had prostate cancer. The doc told me that I was going to deal with a number of issues. He said I was going to deal with erectile dysfunction and I was going to deal with incontinence. And that in preparation for the surgery that I was going to have, that it was very important that I get adult diapers. Now, I want you to know the idea of wearing adult diapers was scary, and I couldn't imagine that it was anything I wanted to do. And I certainly didn't want anybody to know that I was doing it. So I had to figure out, so I got to get these diapers before the surgery. All right, where am I going to go get them? I didn't want to go any place that anybody would see me. So I live in Boston, and I decided I would go to Springfield because I'm pretty sure that there was nobody that I knew in Springfield that would see me buying these diapers. Well, I did. I had the surgery. Things turned out exactly as my doc told me. And so many years later, I am glad to be able to talk about my experience because I know in talking about my experience that it will help others who are anticipating what may happen. It will help others who are going to experience some of the same things that I did. It's important to use the language. It's important to talk about the real deal about what happens. And so I would say to three different audiences, things that I've learned over the years. First, I would say to men who are experiencing prostate issues or any kind of issues, it's important to go to your doc on a regular basis. It's important to go and see your doc. And maybe you'll learn you have prostate issues. Maybe you'll learn you have other kinds of issues. Or maybe you'll just learn that you're just perfectly healthy. But it's important to go to see a doc. It's also important to ask questions. And all questions are important. So if you're thinking it, it's important that you ask that question. And it's important to know that you can say no, that this is your body, that you get a chance to actually take control over how you are treated, but you have to be involved. So that would be to the first audience. Go to see a doc, men. To the second audience of clinicians, I would say, remember to listen to us because this is a very scary diagnosis. It's a very scary thing to actually deal with. And to have someone who's actually listening to us, and yes, docs and nurses and other clinicians are full of information that we need to hear, but you need to hear that we're scared. So listen to us and also know that the system is very complicated and that trying to go to multiple doctors, understand how to engage the system is very, very difficult. So listen to us and understand how complicated the system is and help us to navigate it. And to the third group, I would say to the legislators and to the policymakers that are here, I am grateful for your involvement with the issue in helping to keep it on front burner, in helping to raise awareness about the issue, and to be able to support programs like Dr. Stern's programs and so many other programs that assist people with navigating services and being able to engage. So thank you to all of you for what you're doing. And finally, I would say a big thank you to the people who were important in my experience, my family, and to my two doctors, Dr. Scott Harris and Dr. Andrew Wagner. I'm grateful for you. I'm grateful for what you've done. Thank you for the time to talk today.
Thank you so much, Professor Cox. And I would like to particularly thank you for your major contribution to our ability to craft prostate cancer equity program and to develop materials that would be culturally appropriate. Thank you so much. I would like to introduce next Kenneth Elmer, who is Associate Provost and Dean of Students at Boston University, also a prostate cancer warrior, survivor, who is passionate about raising public awareness of this disease.
I've been living with cancer for about 7-8 years now, and I've been living with it, and that's the good news, that I've been able to do it. 2 stories come out of that, or at least 2 lessons. First lesson, go to the doctor. We've got to get ourselves there, especially those of us men of color. We've got to get to the doctors, and we've got to have regular checkups and visits, and I know that it's been difficult with all that's been happening with COVID and everything else. The other thing, too, is you've got to be able to accept those people who are extending you love, who are trying to care for you, and who are trying to give you advice and thoughts about how you deal with cancer. And not only that, but those folks who are trying to make sure that you understand whether or not you have it. I have a situation where I was going to skip a doctor's appointment, a long overdue doctor's appointment. And I remember my wife would have been incredibly angry at me for doing so. So I decided that I should go to the doctor. Well, thank goodness that I did, because my primary caught my PSA at this astronomical level, had me do some additional tests, and we found out that I was on the verge of stage 4 cancer. Thank goodness I went to that doctor that day. Thank goodness I had a primary who was on the ball. And thank goodness I had people extending me love, people like my wife and others who were able to say, you will get through this, you are going to be fine, and you will be able to live through it if there is an aftermath. And there has been. And I am feeling great and feeling well. But one of the things that I do, I accept the love that I get from people, and I also make sure that I got a regular checkup. That's a part of the love, too. All the best to those of you who are out there dealing with this. And if you'd like to, I'm always available to have a conversation and to extend some love to you, too.
Thank you so much for joining us again, hearing all the perspectives of people that have this lived experience. And I think some of the messaging resonates for me as a nurse to make sure we do listen to our patients. And it is scary, and some of the potential complications are something that nobody really wants to have to deal with. So the voice of the patient is important, and crafting the best plan for each person individually. And so now we are going on to really take a deeper dive into looking at this prostate cancer from the lens of the Black, Hispanic, and Latino community. As we've heard from many of the speakers, the statistics are startling at the increase in morbidity and mortality that these men of color experience. And so it is very important that we talk about this, the disparities and the importance of equity. And again, I am delighted to see the work that Dr. Stern is leading in this area of equity as part of her priorities at AdMeTech. And so I believe we have Dr. Abreu next. Dr. Milagros Abreu is a medical doctor with a master's in public health. She's the founder and president and CEO of Latino Health Insurance Program and a key member of the Prostate Cancer Action Council. Dr. Abreu, thank you for your nonstop advocacy for the Latino community and for prostate cancer. Thanks for joining us.
Good morning. My name is Dr. Milagros Abreu. I'm the president and CEO of an organization called the Latino Health Insurance Program. I would like to thank AdMeTech Foundation for this opportunity to present our findings. My presentation is called Prostate Cancer and COVID-19 and the Importance of Prevention. I just wanted to say that these recordings are being made in the month of February. So we are celebrating the Black History Month. Congratulations to everyone. First, I would like to share a little bit about our organization. Our organization primary mission is to improve access to medical care, improve access to food, and to improve health literacy for minority residents in Massachusetts while reducing medical costs. But we reach our mission by delivering the following activities. We help individuals to apply for medical dental coverage, increase access to early detection and treatment for preventable conditions such as diabetes, hypertension, and some type of cancer like prostate. We host the Metro West Benefit Enrollment Center to help individuals, Medicare recipients, and individuals with disability to apply for supplemental plans, Medicare, Medicaid programs, and we also offer the COVID-19 vaccines in our facilities and across the state. We assist individuals to apply for federal nutritional programs such as SNAP, helping with job development programs, including ESL classes and computer. We provide evidence-based education to individuals with chronic conditions and their caregivers, such as diabetes prevention programs, and of course, our prostate cancer awareness and education. We try to reduce unnecessary use of most costly emergency services while increasing access to primary care and preventable services. All our services are delivered in multiple venues. So my presentation is divided in three areas. What is the relationship of prostate cancer and COVID-19 to increasing the risk for individuals with this condition for severe illness of COVID-19, for those individuals to increase access to vaccination to reduce their risk, the Prostate Cancer Awareness and Prevention Program by LHIP that includes the benefits of PSA education, informed decision-making, and evidence-based education, and also our efforts to increase access to vaccine for COVID-19 for any individual in the state of Massachusetts from the age of 5 and over. So the relationship of COVID-19 and prostate cancer is a bidirectional relationship, especially for individuals of color. Given the great disparities that exist for minority men, COVID-19 have exacerbated the underlying issues among healthcare disparities. In areas where there are high-risk communities with COVID-19, there is also an incidence rate of prostate cancer, especially for African American men and Latino men. We also know that people with these chronic conditions like prostate and other underlying conditions like diabetes, hypertension, cardiovascular disease are at higher risk for severe illness for COVID-19. Our goal is to reduce the disparities related to these conditions, and we have been able to achieve thanks to the support of the AdMeTech Foundation and also our government. I wanted to share now about how we have achieved our goals for this program the Diabetes Prostate Cancer Awareness and Prevention Program, and what have been our successes and how we can thank our legislators and AdMeTech Foundation for their support. LHIP Prostate Cancer Awareness and Prevention Program, I would like to thank their support to this program from the AdMeTech Foundation and the legislators, because thanks to this program and the funding provider, we have been able to develop a sustainable prostate cancer awareness program for Latinos and African American men in Massachusetts. The men receive the following services: one-on-one education to discuss their risk to develop prostate cancer. These individuals have clinical encounters with licensed health professionals, informed decision making. They also have been able to receive free PSA testing in our clinic in Framingham to reduce the disparities in access and treatment for these men. They also have receiving education about COVID-19 and how to assess vaccines. They are, after the results are made, they have been able to be referred to specialists, and they receive appropriate referral to urologists, cardiologists, endocrinologists based on their results. Patient navigator is being offered to these men and their families to apply for medical dental coverage, federal nutritional programs, financial assistance due to COVID and other support. And this not only for men, but also for their caregivers. Health education to improve their behavior, lifestyle changes to reduce the risk. As we saw, many of these individuals are being impacted by other chronic conditions such as obesity, diabetes, cardiovascular diseases, or mental health. And these also programs have been able to help these individuals to reduce isolation by providing group activities, virtual access, and mental health to reduce their stress. So we would like to thank all of you for this support. So one of the aspects of these programs during this pandemic is to provide this education and the prevention program via virtually for those individuals who cannot travel to our locations. We have 2 offices, one in Framingham and one in Worcester, but thanks to the virtual learning, we have been able also to provide this education in multiple locations across the state. All participants have joined these classes via Zoom, telehealth, using the tablets, mobile phones, and we also understand the health literacy issue and computer literacy issues, so the education is being provided prior to their visit to our clinicians virtually using these technologies. So some of our results show that among the participants in our program, it was great participation. We were able to assist them with education about changes in their behavior by connecting with other evidence-based programs. They lost 51 pounds. They were able to be engaged in ESL classes, virtual classes, receive assistance with emergency food, and so on. They were also educated about COVID-19 risk, how to avoid this infection. They got access to vaccination and PPE. Among the 680 men educated about the risk of prostate cancer in COVID-19, 160 men were PSA screened. 9 were diagnosed with treatable prostate cancer. Unfortunately, 4 were at a later stage of prostate cancer and died. LHIP clinician reassure men who have normal screening, as well as assisting men with suspicious screening by helping them to obtain our services, referring them to experts so they can get the appropriate medical care and treatment. 200 also completing virtual classes for our diabetes prevention and other workshops. 148 were found positive with COVID-19 by providing access to testing. All participants were residents of a number of communities across Massachusetts, mostly from Metro West, Ashland, Erie, Worcester, Milford, and some as far as Springfield, among other communities. And I would like to extend my gratitude for this opportunity, and this is my contact information. And let's continue to provide access for education and treatment for men of color. Thank you.
Thank you so much, Dr. Abreu. Thank you for your partnership. And I also want to thank Dr. Abreu for her openness. When several years ago, she gave me an opportunity to train her primary care physicians in the best clinical practice guidelines for early detection for prostate cancer that we have today from National Comprehensive Cancer Network. And she implemented successfully these very advanced clinical practice guidelines that are used by leading academic institutions in this country to people who need it the most. And thank you for saving lives. Our next speaker is a very dear partner of many, many years, Phyllis Ellis. Her name was mentioned by Jerry Cassidy. She is a president of Brockton Area Branch NAACP, and I am proud to call Phyllis my friend. Phyllis has been working with Steve Barnard, immediate past president of NAACP, a leader at the time we initiated our program in Brockton, Plymouth County at the time, and Plymouth County had the highest African-American mortality in prostate cancer in the state. Together with the health chairs, Leona Martin and Janet Trask, they ensured broad community engagement that transformed situation of Plymouth County. As Jerry mentioned today, African-American men mortality in Brockton and Plymouth County is about half compared to that of state average and national average. And we reach near parity in Plymouth County thanks to this partnership, and also partnership is Good Samaritan Medical Center. Phyllis Ellis, please.
Hello, I am Phyllis Ellis, president of the Brockton Area Branch NAACP, and I am very pleased to take part of the 13th Annual Prostate Cancer Awareness Day. The Brockton Area Branch has been partners with AdMeTech Foundation and Good Samaritan Medical Center for about 6 years now, and we could not have asked for better partners. Our mission is, and will continue to be, to bring awareness to men, especially Black men, about prostate cancer. When we started our partnership, Brockton had the highest rate of mortality among African American men. Today, those numbers have decreased, and it is due in part to the prostate cancer events we host each year. We are so grateful to the doctors who participated in these events. The doctors give their expertise in their various fields, and their expertise has proven to be worthwhile. We want men to know their risks and to take charge of their health. We want men to protect themselves and their family. We want men to know the cutting edge advances on prostate cancer care. We have had personal stories of men who have attended our events. After attending one of our events, one gentleman decided to go and get tested. He was diagnosed with prostate cancer. He had surgery and he's doing well to date. He has attended a few of our events to tell his story of how grateful he was to get information on prostate cancer, information that he was not aware of. We have been hosting on an average 3 events a year for the past 6 years. When we were in person, we hosted events at various churches, at an MLK breakfast, and at a golf tournament. Then COVID hit, but COVID did not slow us down. We went to Zoom because we know the importance of bringing about prostate cancer awareness. Other NAACP branches have been invited to participate in bringing prostate cancer awareness in their area because it is so important to do so. So the Brockton Area Branch NAACP's mission is to continue working with Dr. Stern of AdMeTech Foundation and Lynn Cornelius of Good Samaritan Medical Center and the many doctors in bringing prostate cancer awareness to our community, because prostate cancer kills, and we are ready to fight back. Thank you.
Thank you so much for your partnership and the work that Brockton continues to do. And those are pretty impressive changes in the statistics that hopefully we can bring across the state to other communities. So congratulations for the work you're doing. And our next speaker I'm pleased to introduce is Dr. Guy Fish, who's the president and CEO of the Greater Lawrence Family Health Center and a long-term partner of AdMeTech Foundation. Thank you for joining us, Dr. Fish. Look forward to meeting you as a fellow CEO of a health center.
Hello, I'm Guy Fish, President and CEO of the Greater Lawrence Family Health Center in Lawrence, Massachusetts. I have been working with AdMeTech for many years and wanted to spend some time conveying a message to you about the importance of prostate cancer awareness and screening. If times were different, this would not be a video recorded message, but here we are coming on the tail end of COVID, and I hope you are safe. But I wanted to convey with you several things about what you can do to live a healthier life and not cut short because of the risks of prostate cancer for either you or your loved ones and the opportunities to avail ourselves of the best of medical and health knowledge, which oftentimes means addressing some of the social determinants of health that create barriers to access of care. So there are three messages I would like to convey this morning to you on the topic of prostate cancer. First, prostate cancer, particularly in the African American community and Latinx community, affects all of us. Second, if not addressed, the impact of prostate cancer can be devastating. Overall, as African Americans, we have not been addressing it, and there are some communities that are doing a better job, Brockton, for example, but there's more work to be done. And third, there are new tools and methods to change our experience with prostate cancer. So first, let's talk about prostate cancer and how it affects all of us. If I were present with you and asked all of you who have either had or have a loved one with prostate cancer, many of you would raise your hands and I would be included among those. It was my father. My dad, John Fish, was a chemist, and his father, Frederick Fish, was a schoolmaster. My mother, Juanita, is a nurse, and her mother, Martha, was what we termed domestic back in the day. I grew up in Cleveland, Ohio, with three sisters, and one of whom I was very competitive with decided to go to an exclusive women's college. So my ACE card was to apply to and get into Harvard. Attending Harvard was not easy. As W.E.B. Du Bois said, being at Harvard and not of Harvard at the time. But God is good, and after finishing there, I attended Yale School of Medicine. And there, while a medical student, I got a call that none of us are prepared for. My father called and gave me news, and despite studying medicine and disease and even cancer, I can still remember him telling me that he had been to the doctor and found out that he had prostate cancer, and it floored me. I know personally how hard it can be to hear that. Fear, doubt, betrayal, sadness, compassion. The entire family goes through that. That's what I mean by it affects all of us. Okay. This story is one of good news because by finding out about it early and by my mother and me being plugged into medicine, we took full advantage of all that was possible. And Dad lived 12 more years, saw the birth of 6 grandkids until he went home. 1 in 8 men get prostate cancer, but only 1 in 40 will die from it. That's an interesting statistic. It means that there are things that we can do where if you get prostate cancer, 1 in 8, your chances of dying from it can be considerably less. But it varies significantly for those who are African American, where the odds are 2.5 times worse. What matters is early detection. The overall 5-year survival rate for prostate cancer can be 98%. But with early if you split it between those who are detected early and those who are not, those detected early, the 5-year survival is 100%. For those who have a late diagnosis of prostate cancer, only 28% are alive after 5 years because the prostate cancer has spread to the bone and other distant organs. So clearly, with early diagnosis, you could live for 5 or, like my dad, 12 more years. But Black men are dying like flies. And that's because we're not doing something right. So how do we change that? Well, there are some new tools and methods to change our experience with prostate cancer. That was point number 3. We want to screen early, diagnose early, and treat aggressively this disease. If you do test positive, you may need to go on to more advanced testing, which is to confirm the diagnosis through a needle biopsy. There are other new tests available, some blood tests, which may be able to make the diagnosis or at least the suspicion of a prostate cancer without a biopsy. It's worth talking to your physician about those too. If you do go on to a biopsy, even half of those come back negative. So the odds are in your favor. You need to be screened so that you are on the more favorable side, should a prostate cancer be there, of something being done to treat it. But the odds are strongly in your favor that the test results will be negative. If you don't look, you won't know. Many of the prostate cancers that are found can actually be watched to confirm that they are not aggressive tumor. And there are new tests also emerging to tell which ones can be watched and which ones need to be aggressively intervened with, usually by surgery. To wrap up, prostate cancer, particularly in the African American community, affects us all. If not addressed, the impact can be devastating. And there are things that we can do in the African American community and other communities to increase our engagement with prostate cancer screening, testing, and diagnosis. And particularly, there are new tools and methods to change that experience with prostate cancer so that your 5-year survival or longer can be more like my dad's. Hopefully, the message you'll receive today is that this is a treatable, detectable disease, and we can actually give a more full life if all of us have access to the tools and recommendations that go along with the proper care and management of prostate cancer. Thank you very much.
Thank you so much to Dr. Fish and for his partnership of so many years. Do we have any questions from the audience for Dr. Trink, Dr. Feldman, and Dr. Sokolov? And then I will be asking questions. Starting with you, Adam, what do you think about, what would be your take-home message for our audience regarding recent advances in diagnostics? And what is important for them to do? And how does Prostate Cancer Equity Program fit with that?
I think so first of all, thank you for, involving everybody and taking the time. I think that the take-home message for everybody right now in 2022 is that there are a number of diagnostic tests and advances in diagnostic tests, which I think we've made a lot of progress in. And I think the key is, as everybody has discussed, is making sure that all communities have access to quality care and screening, and have the ability to talk to their physicians about screening tests. The sort of baseline screening still is, PSA, the blood test, and a prostate exam, a digital exam, and that, as was just indicated, that there may be additional tests that are recommended based on that initial PSA, but I think starting with those basics is important and incredibly important for people to do. So I think that's probably the most important message, is just knowing to get screened and to think about that, and make sure that message is spread to all communities in the state.
Thank you so much, Adam. And what is important for me also to add is that PSA screening got a bad rap, mostly from people who did not quite understand the role of screening when we are testing normal and healthy men with the role of diagnostics, and they actually try to eliminate the screening tool that saved countless lives. It was a story very similar to what I saw as a head of diagnostic imaging at the National Cancer Institute in the early 90s with mammography. And our what we chose to do with mammography, not necessarily to get involved in conversation that didn't quite make sense for experts, but instead to focus on development of accurate diagnostic tools. It is not the job of a screening tool to determine who needs or does not need to have biopsy. It is not a job of a screening tool to determine who needs or who does need treatment. It is critical that we have these advances in precision diagnostics mentioned by Dr. Feldman. So, because right now we know when men did have screening with PSA blood test, now with accurate diagnostics for men whose risk was identified on screening, now we can eliminate unnecessary biopsy. We can focus on men who need biopsy. We use image. No, we do not do blind biopsies anymore. We use imaging in order to guide biopsy properly. It's a transformation in patient care we've seen in the last 5 years, and it all our ability to help men starts with their willingness to discuss with their doctors whether or not PSA screening is right for them. If you have any questions after conversation with your doctor, please contact Summer Mills at AdMeTech Foundation, 617-523-3535. And Dr. Feldman, Dr. Sokolov, or Dr. Trink will help you guide through the process of whether or not PSA screening is right for you. Give us a chance to save your life. What is your take-home message? And by the way, guys, before I will proceed, I want to thank all of you for lending your world-leading expertise in spite of absolutely brutal schedule as clinical surgeon. Your dedication, your showing up at prostate cancer awareness events we've had all over the state, and your partnership in creating prostate cancer equity program. Now you're willing to actually dedicate your time to seeing the most underserved men. Thank you so much. Kwok, what is your take-home message from health disparities perspective? What is your main concern, and how our prostate cancer equity program can help address these concerns?
Again, thank you for having me. And to answer your question quite directly, I would just build on what Adam said earlier. And from my perspective, it's just that things are more complex than what they used to be, right? It's not just high PSA, do a biopsy, get surgery or radiation. Now there's PSMA PET, there's MRI before biopsy, fusion biopsies, in-bore biopsies, germline genetics, somatic genetic testing. When you put all this together, patients, it can get confusing. It was already confusing before, and now it's getting even more confusing. And you also have to rely on experts a lot on this, right? It's hard to put all this together, stay up to date to the literature. And, hence it's really important for men who are diagnosed with prostate cancer to seek the right opinions, seek a second opinion if necessary, and to guide them through this increasingly complex process that is sometimes extremely daunting and hard for even us as, specialists to fully understand. And I think that's going to be key to really alleviating the disparities issues that we have here, because a lot of studies have often shown that when something new comes along, either it is prostate MRIs or germline genetic testing, often underprivileged patient populations are less likely to get these tests first, right? And if these tests are so important to the care that follows, disparities will only get worse instead of getting better. And that is why all of us here on the line are so dedicated and feel that this is so important to raise awareness and make sure that everybody gets the care that they deserve.
Thank you very much, Kwok. And in particular, I want to personally thank you for joining us today in the middle of your family vacation. Thank you so much, Kwok. And thank you for your passion about and your world authority on health disparities. Thank you for being here today. Mitch, you've been an incredible partner to us in prostate cancer awareness and education. Indeed, you introduced us to Lova Kaligo. You pointed out to us that the community that Lova and her organization serves, African immigrants, have a particularly aggressive prostate cancer. You and Lova had made tremendous difference for this man. What is your take-home message, perhaps with some focus on therapeutics?
Sure. Well, first, I want to echo what Kwok and Adam said in that everything they said, actually. I mean, getting people educated, aware, screened, and into the system is important. And then, with all of the new technologies and all of the new aspects of evaluating somebody, it gets incredibly complicated. It can be very expensive. And a big challenge, obviously, is in those real socially disadvantaged, medically disadvantaged communities, which we see so much of here in central Massachusetts, is being able to actually get them into the hospital. There are employment issues, there are transportation issues, there's childcare issues, there's just overall knowledge. Like, I don't even have PCPs. When it comes to the technologies, one, which isn't really much of mine as a surgeon per se, but I have found very helpful in the last few months, is the Psma PET. I think that's a huge step forward on trying to identify men with oligometastatic or even latent metastatic disease. And I think that's crucial as you're counseling people with high-risk disease for surgery or radiation. And that's what we see mostly. We see mostly very high-risk patients. But as with everything, and every time we've talked and we've spoken, it's minimizing the treatment so you get the maximum effectiveness with the minimum side effects, whether it's single port surgery, whether it's robotic surgery, where now our radiation oncologists are using, half the time for external beam as compared to one. In terms of technologies on the localized side, it's being able to make sure that that disadvantaged population has access to a center that has all of that. I mean, outside of the Boston Beltway and probably Leahy, I don't think Springfield has access to those kinds of technologies. I mean, they're very select because everything's so expensive. And then on the systemic side of things, I mean, lots of advantage on new molecules and, as I mentioned, new ways of staging disease. And I think those are the exciting prospects that are going to change the course. But it all starts, as Adam said, with getting a patient screened and into the doctor's office to figure out what's going on.
Thank you very much. Any other questions? I assume we do not have any further questions. I want to, again, leave everyone with the message that everything starts with screening. And for men aged 40 who have family history, for men or African heritage, Black men, for men who, for any man starting at age 45, please discuss with your physician if prostate cancer screening is right for you. And if you have further questions, please come to us at AdMeTech Foundation, and we will be working on getting you to the right doctor, people like Dr. Sokolov, Dr. Feldman, and Dr. Trink, in order to sort out what you need and provide to you information about all options that you may have that are the best options in patient care available today. If there are no further questions for our physicians, I would like to thank everyone for your participation. I am very grateful. And I would like to formally close our formal program, and we will proceed with a few presentations from virtual exhibits from our community partners. Thank you so much, everyone. And we will be switching right now to virtual presentation exhibits. Cheryl?
Yes, thank you. Thank you all again for your time. I know you're busy medical professionals, but your knowledge increased every year helps the the rest of us to support the men in our lives. So thank you. And now we are doing virtual exhibits, which is kind of exciting. And I'm happy to introduce Lamont Scott and Albert Hubert, leaders of the Men of Color Health Awareness, MOCA, members of the Prostate Cancer Council, and AdMeTech's partners in the greater Springfield area. Thank you for the work you've been doing for well over a decade now.
Good morning. My name is Lamont Scott. I'm the MOCA Project Director. I'd like to introduce my right hand and my brother and mentor, Brother Al.
Hey, thank you. First of all, we'd like to say thank you for allowing us to be, MOCA, thank you for allowing us to be here at the 13th Prostate Cancer Awareness Day. We're just grateful to be here to talk about prostate cancer in the Springfield community.
So thank you, Brother Al. So I'm just going to elaborate a little bit about MOCA. MOCA's been around for almost 13 years now. And we've been connected with coming to the State House and supporting prostate cancer and getting out the information. And always we've been bringing a big crowd up to the State House pertaining to prostate cancer so we can get more awareness in Western Massachusetts, especially in Springfield and our surrounding areas, to men of color who may not be aware of the information that needs to get out. We're usually bringing 60 or more people, but seeing that we're doing this virtually today, it's a blessing just to talk about some of the work we've been doing in Springfield. And a lot of the work has been focus groups. It's been attending other functions in the community. We're also part of the Springfield Black Coalition with Bud Williams, where we also get the word out quite regularly, especially through these times of being virtual and still going through some of the pandemic stages. And but we've been successful getting and meeting men and getting our focus groups moving forward. Brother Al, would you like to elaborate on some of the work we've been doing and some of the work that we'd like to talk about?
Thank you, Lamont. Yes, MOCA and AdMeTech has collaborated together to bring education and awareness about prostate cancer in our community. We know that MOCA was developed to target and bring health and awareness, to diabetes, high blood pressure, etc. But the most important thing, that prostate cancer was a silent killer in this pandemic season. And we know that 1 in 7 men, African-American men in the United States, will be diagnosed with prostate cancer. Bringing education and awareness, the African-American 1 in 5 will be diagnosed with prostate cancer. And then 1 in 3 men whose father or brother has had prostate cancer. So we wanted to educate. We wanted to bring advocacy in our community with the bridge building that we have done with AdMeTech.
Thank you, Brother Al. Also, I'd like to say we also know and have been learning, even though we know we're not doctors, but we do get we do have the opportunity to getting the information out to men pertaining to prostate cancer, which that's only because of going to the State House regularly over the past 10 years. And thank you, Dr. Sanford James, and also Dr. Stern for allowing us to be a part of this. There are so many others that I can mention moving forward that supported us as we move forward and getting information out throughout our community. We've done numerous education pieces at different events. And now that we're moving back to maybe hopefully it won't be virtual, we'll be able to target more men within our community. We also know that diet, exercise, and also regular checkups, we have to hold men accountable to doing that to find out more information about prostate cancer, because we found out that a lot of men are not educated pertaining to prostate cancer. And that's what we're here for. We do not answer any doctor questions. We leave that up to the professionals, but we do get out there and let men know that they need to get checked regularly, especially being an Afro-American man or a Latino man in the age of 40, just to kind of get an eye and keep a check on things as we move forward. And we also talk to the women, because their wives and significant others, because we know that wemen are the sole key holders to pushing us to go get our health and wellness, because we know they do such a great job, and we'll kind of follow that piece of it to do the same ourselves. Prostate cancer is not going anywhere, and also my understanding there's new technology that men can find out their PSA levels through a blood work, where it'll be easier and feel more comfortable about going to see the doctor without having to do a digital exam at that point in time. Brother Al?
So we know that he brought up Dr. Sanford, and partnership fueled by common vision and passion and commitment, and the steadfast and support is very important down here in our community about prostate cancer. Once again, Lamar said we're not doctors, but educating and having advocacy in our community will help men to ask important questions with their doctor. And as I said, that 1 in 5 African American men will be diagnosed with prostate cancer. So them not knowing that, my grandfather had it, will I be able to get it? And absolutely, if you're not going to be checked on a regular basis, it's so important. And then if you do find that you're with some type of cancerous, surveillance is very important in prostate cancer. You might not have it, but you can, on a regular basis, check. He also talked about digital things.
Digital rectal exams, yep.
So we know it's not the finger that's killing us, it's the cancer, and that's what we tell men. So it's not about your pride or your ego, but it's about the cancer that you can develop within a certain age as you get older. So we want to continue to work, and we have worked with other organizations, and he did bring up Springfield, the Black Springfield Coalition with State Representative Bud Williams and Chairman Morgan and Co-Chairman Doris Harris. We're also they are able to support us in bringing information in our community through radio, through community work with these other organizations is so important for us.
Thank you, Brother Al. Just so we don't hold this too long, we just want to wrap it up and say we're more than appreciative to be part of giving the information out and the understanding and awareness pertaining to prostate cancer. And as Brother Al elaborated on, we're also doing some upcoming events coming up. One is going to be a radio show on STCC. We're looking forward to doing a breakfast. And we're also looking forward to hear from other men throughout the state, through Boston, Central Mass. There's some brothers up there that's doing great work. So we'd like to see and hear what they're doing and also stay connected. I seem like this virtual and this pandemic situation with the virus have kind of kept us apart, but hope this will be a place where we can kind of put things back together and collaborate and get more information out pertaining to prostate cancer as we move forward in 2022 and beyond. Thank you for allowing us the time and have a blessed day. Brother Al, would you like to say something before we close?
No, once again, Mocha just truly appreciated to be a part of this Prostate Cancer Awareness Day, and we're looking forward to doing great work in our community and with other organizations as we continue to travel this path.
And I'd like to say once and again, Dr. Stern and all the staff, I want to say thank you for allowing us the time and being part of this and continue to believe in us in the work that we're doing here in Western Massachusetts. Thank you.
Thank you so much, Lamont. And Al, thank you for your work in Springfield. Actually, Greater Springfield, not just Springfield. It is a pleasure for me to introduce another longtime community partner, Dr. Skerritt, founder, Center for Elimination of Health and Social Inequities, Disparities, SACSED, and member of the Prostate Cancer Action Council. Dalton has been leading a grassroots community program, not dissimilar to MOCA, but with extensive involvement of community health centers, centered on African American, Hispanic, and Latino men. Dalton Skerritt, please.
Welcome to today's 13th annual Prostate Cancer Awareness Day. We just welcome everybody to this event. It's a wonderful event. And just want to give special recognition to AdMeTech Foundation and Dr. Van Stern, also all the staff of AdMeTech Foundation, who has labored tremendously to bring to us this event today. We are here, we're live with you, and at the same time, we are just here to support all the other agencies who are involved. And also special recognition to our Governor Charlie Baker, all the delegates, representatives, House of Representatives, and also all of the non-profit organizations who are present with us today, who are in the fight against prostate cancer disparities. We just thank you again. I'm Dalton Skerritt. I'm from the unique agency which is called the Center for Elimination of Health and Social Inequities and Disparities, Inc., usually called CECID, Inc. we're here today to give you some information as to some of the progress in prostate cancer fight against disparities for prostate cancer within our communities. And CECID covers a vast area, which is across the entire Massachusetts area in terms of educating men and also linking them to primary care and supporting them up towards the actual elimination of cancer disparities, especially focusing today prostate cancer. Also, in looking at today's Prostate Cancer Awareness Day, it is so critical that we continue in this movement to make sure we drive awareness so that at the end, death and suffering in our communities, we lower that as well. Let's look at some of the areas that CECID focus on. So CECID, as this poster or card would say, it's a very comprehensive and innovative men's health program. It covers a wide array of services, including not just men's health education, but even on many occasions have collaborated with other agencies and organizations, especially at the community health center level, which we consider the front line of healthcare. So in looking at healthcare for this modern day time, we cannot leave out the community-based community or neighborhood community health centers. Those are able to reach people that we may not have a chance until the last minute. They will go into the emergency room at one of our world-renowned hospitals. So what we are doing is be the tentacles, long arm into the community, even further, where the community health centers may not reach that gentleman who lives 2 blocks down the road, or maybe a half of a mile down the road. Here comes CECID, and we'll reach that individual at an event. It could be at a barber shop, it could be at a soccer game, it could be at a cricket game that's played by some of the West Indians in Franklin Park. It could be a domino tournament, various aspects. Even in an Uber, we're capable of reaching people as well and across the world. So what we do best is navigation and care coordination. And the reason I'm using this terminology, just to let you know, one of our treasures is that from the Massachusetts Department of Public Health, which we want to have a chance right now to recognize very highly, the Massachusetts Department of Public Health, created some excellent tools in the past that CECID has adopted and even modified on that and have gone further with it. But those are the fundamentals that help us. And when you look at even these tools that we use to educate men so that they can see what a prostate size looks like, what benign prostatic hyperplasia looks like, so when prostate enlarges, and when tumors are formed and so forth. We're able to use all these things from Massachusetts Department of Public Health, and also even some of our pharmaceutical companies who have some amazing gizmos that we can use where men can touch and feel texture and see what an enlarged, what it's like, what's the size of a prostate again, and other things. So the Massachusetts Department of Public Health, when they came out with a care coordinator program, when they created, along with several other agencies working together, the CHW model, the community health worker model, I think that was exceptional because it allows us to integrate the health centers and all the resources of the hospitals into the community, and thus capturing those high-risk individuals or men, especially of risk, men of color, men of African descent, men of Caribbean descent, Latino descent. Some are from Cape Verde, some are from Haiti, some are from Jamaica, some are from other islands in Honduras, different places. And what we found was that we were able to, based on linguistics and based on the tools that we had, be able to reach those men right where they are and be able to explain to them the importance of screening for prostate, importance of overall health. And that's where CECID comes in. So CECID has an entire curriculum geared towards men's health, and it has a 3-tier system where they get men's health 101. Then the next level is men's health ambassadorship, where they now be able to be a trainer and train others. And then The third level is where we refer them to the Boston Public Health Commission. We refer them to programs of Massachusetts Department of Public Health so they can go further, get training and certification as a CHW or community health worker. And in that case, it's even an added value to most health centers, academic teaching institutions or hospitals, or just being, as we put it, the extra tentacle that reaches into that community, reaches that man that's 2 blocks away from the health center, who still did not access all the resources that's right there at Mattapan Health Center, Codman Square, Brookside, Southern Jamaica Plain Medical Center, or even Whittier Street and other things. So you always need agencies like CECID to go further and reach the individuals on time, making sure that we reduce those risks of men ending up at stage 4 by having not access adequate and proper care in time. If you ever want to reach us, again, you can reach us at CECID.org, CEHSID, as in David.org, or 617-637-7091.
Thank you so much, Dalton. Thank you for your partnership. Cheryl, do you want to adjourn?
Yes, absolutely.
This event? Thank you.
I want to say thank you to our sponsors. Without, we couldn't do some of the work that we do, and our co-hosts, again, Senator William Brownsberger and Representative Jerry Cassidy, longtime supporters and hosts of this annual Prostate Cancer Awareness Day. All of our presenters, the information continues to grow the knowledge base across the state of Massachusetts. I think we've got to be the best in the nation in terms of educating not only providers, but the public at large, men and the women who love the men who need to get the care they need. So learned a lot again today. And I think a takeaway message for me is that with work, we can change the outcomes in communities by significant amounts, by educating people, by getting people early detected and early treatment. The health outcomes can certainly improve, and Brockton is a wonderful example. And that's an example of the great dedication and work of AdMeTech, leadership by Dr. Faye Stern, and the leaders of NAACP in Brockton and the Good Samaritan Medical Center. So together we can make a difference. So let's all go back to our communities and take what we've learned and see how we can reach out to AdMeTech for help and bring this kind of results into each of our communities and regions across the Commonwealth. Thank you all. And again, God bless loved ones in the Ukraine, and I pray for peace and safety for all.
Thank you so much, Cheryl. I would like to thank everyone for your participation. I also would like to say that many of you in the past came to us for help as individuals to be referred to great physicians. Based on this experience, we have, and we connected many of you, probably participating today, to many great physicians, including physicians who participated today. We created Prostate Cancer Equity Program to make it available to everyone in Massachusetts, and we stand ready to bring the latest advances in screening, diagnosis to treatment to every man in Massachusetts. Thank you for your participation. Thank you for your support. Let's pray together for peace. As Cheryl pointed out, if you will have an extra moment to pray for peace in Ukraine, it would be appreciated by me personally. If you can support Ukraine in any way that stands right now between dictatorship and civilized world, it would be also appreciated. Otherwise, again, thank you for your support. Thank you for your participation, and God bless all.